The hearing will come to order. I know we still have our caucuses and our conferences are going on, so I understand some of our members will be here a little later, but we want to get started so we can start as close to on time as we possibly can. I want to thank everybody and welcome. It's been a little while since we've gotten back together as a committee to see these things, but we have a new report that is worthy of our attention. It's good to see our CBO Director, Doug Elmendorf, once again, and I want to thank you, Doug, and your staff for putting together this very important and valuable report. I know what kind of work it takes, and we appreciate that. We want to put it to good use because, as I read it, your report makes one thing clear. We haven't solved the problem yet. We still are spending too much money. Just look at the numbers. Our total debt is bigger than our economy, and according to your report, our publicly held debt as a share of our economy is higher than at any point in the U.S. history except for a brief period around World War II. Some seem to think that just because the deficit is not $1 trillion anymore, we don't have to worry. Problem solved. But we know better. In 2008, our publicly held debt was 39% of gross domestic product. Today, it's 73%. In other words, it has doubled in just 5 years. So today, if we were to have an emergency, we will have a lot less leeway. When you owe more than you make, your creditors get antsy. Sooner or later, they cut you off. Problem is, they could cut us off at exactly the wrong time. We've heard a lot of talk these days about how we need to pay our bills. But we need to make sure that we can pay our bills today and tomorrow. Look, we know what's driving our debt. It's spending, especially spending on health care. CBO says that most of the spending growth in the near future will be in Medicare, Medicaid, and the Affordable Care Act. In the next 25 years, it expects spending on health care programs to grow by 74%, or maybe as much as 83%. And yet all of this spending, for all of this spending, what are we getting for it? The Medicare Trust Fund will go broke in just 10 years. That's after payrolls went up, after the health care law made cuts to the program, and after the sequester made even more cuts. All of these adjustments, especially the health care law, were supposed to patch the hole, but instead we took on more water. Clearly, a little tinkering isn't enough. We need a whole new approach. Your report says that the debt is too high, and the sooner we get to work, the better. That's a really important point here. You looked at the spending package that would have saved $4 trillion over 10 years, which is roughly what the House-passed budget would do. If we enacted such a law, a $4 trillion spending package, interest rates would be 1% lower in 2038, our economy would be 7% bigger, and our publicly held debt would be just over 31% of GDP. But if we stayed on the current path, interest rates would rise, our debt would grow, and our economy would be 4% smaller in 2038. What does that mean? That means about $3,200 less per person in America at that time. I think the best illustration of our problem is what you call the fiscal gap. What would it take in spending cuts, tax hikes, or both just to keep our debt stabilized? If we took action now, it would cost us roughly $145 billion per year. But if we waited, it could cost us up to $350 billion per year. We've got one foot on each side of a crater. And every day we wait, the gap grows larger. Every day we wait, it gets harder to bridge that gap. Washington's motto is never do today what you can put off till tomorrow. But tomorrow is a whole lot closer than we think. And we know what the answer is. We know that with real reforms, we can not only pay down the debt, we can help grow the economy and put people back to work. It's not a matter of ability. It's a matter of will. And with that, I'd like to recognize the ranking member for his opening remarks.
Thank you, Mr. Chairman, and I want to join the Chairman in thanking you, Dr. Elmendorf, for this report, which looks at the budget picture out until the year 2035 and clearly demonstrates that on our current trajectory, we're on an unsustainable path with respect to the debt. It indicates that we need to move forward on two fronts, in my view. First, we've got to act now to kick our economy into higher gear, to put more Americans back to work. And there are a number of steps we need to take to do that. But an earlier CBO study and letter also indicated that one way we can do that is to replace the sequester that's in place right now, which you indicated earlier would cost us hundreds of thousands of jobs between now and this time next year. that's a self-inflicted wound. That's a wound that this country cannot afford. More people could be put to work if we take care of that issue. Democrats in the House have now tried 8 times simply to get a vote on our plan to replace the sequester. This Congress, we've not seen a single plan put forward by our Republican colleagues to do that. So let's work together to replace it in a way that achieves the same amount of deficit reduction or more without the self-inflicted wound of hundreds of thousands fewer jobs. We can do that now. We also should act now to put in place a plan to address the long-term deficit challenge. And in my view, we should adopt the kind of frameworks recommended by every bipartisan group that's looked at this issue in recent times. Not adopt every particular recommendation, but their overall framework in terms of making cuts, but also cuts to tax breaks for very wealthy individuals and special interests. The House Democratic budget, the President's budget, all those budgets take that kind of balanced approach. We had hoped that we would be able to go to a budget conference to try and resolve some of the differences between the House Republican budget and our budget. That's the way you deal with the long-term challenge. We've tried time and again to have conferees appointed, and obviously the clock has been run out and the Speaker refused to even allow us to go to conference to try and reach a compromise and negotiate these issues. So let's move forward. Unfortunately, right now in the House, we're focused on something very different than solving this long-term challenge. We've got before us now a proposal that would shut down the government if we don't shut down the Affordable Care Act. The Affordable Care Act, which is already providing help and health protections to millions of Americans and will provide millions more with access to affordable health care in the days to come. But right now, the position our Republican colleagues unfortunately have taken is that we're going to shut down the government if we don't accomplish the goal of shutting down the Affordable Care Act. And what is even more troubling is it appears that they're going to double down on that strategy with respect to the debt ceiling, with respect to whether or not this country pays its bills on time. And they're going to say that we're not going to pay our bills on time in the United States of America unless we shut down the Affordable Care Act for 1 year. That is irresponsible and reckless given the impact that not paying our bills would have on the economy. And finally, Mr. Chairman, I just have to point out an incredible irony. The Congressional Budget Office has pointed out the Affordable Care Act will actually reduce the deficit by billions of dollars over the next 10 years and even more over the next 20 years. So to tie the defunding of the Affordable Care Act to the debt ceiling is to say, well, we're going to attach something that will increase the debt to a provision on the debt ceiling. And this was recognized by our Republican colleagues in their budget. I think many people have forgotten that if you look at the Republican budget, it only balances in 10 years because they kept major parts of the Affordable Care Act. They kept all the Medicare savings, and they have the same level of revenues as the Affordable Care Act in their budget. You don't have to take my word for it. Here's a quote from the Heritage Foundation. Quote, "Perhaps the biggest shortcoming of this House Republican budget is that it keeps the tax increases associated with Obamacare. In fact, the budget would not be in balance. The Republican budget would not be in balance in 10 years if not for the Medicare savings in the Affordable Care Act and the fact that you have the same amount of revenues." So it is saying two very different things at once, trying to have it both ways to say you're going to balance your budget and you're going to get rid of Obamacare when you rely on Obamacare to balance your budget. So let's focus on the real issues here, Mr. Chairman, and the issues in this report, and I appreciate the time, and again, welcome, Dr. Elmendorf.
Clearly, we see things differently. Dr. Elmendorf, the floor is yours.
Thank you, Mr. Chairman, Congressman Van Hollen. To all the members of the committee, I'm very pleased to be back with you again today. The bottom line of CBO's long-term budget outlook this year is the same as it was last year. The federal budget is on a course that cannot be sustained indefinitely. In our extended baseline, which largely follows current law, we project that federal debt held by the public would rise from 73% of GDP today, already very high by historical standards, to 100% of GDP in 25 years, even without accounting for the harmful effects of rising debt. The deficit has shrunk dramatically during the past few years, from nearly 10% of GDP in 2009 to about 4% this year. And we expect under current law, the deficit will decline further in the next few years to about 2% of GDP. After that respite, however, we project the deficits would begin growing again. Federal spending would be pushed up by rising interest payments on the federal debt and by growing costs for Social Security and the major health care programs, Medicare, Medicaid, and subsidies to be provided through insurance exchanges. Interest payments on the debt would rise as interest rates rebound from their current unusually low levels. In particular, with debt so large, the increase in interest rates that we expect would have a very large effect on interest payments by the federal government. Projected spending for Social Security increases relative to GDP in our extended baseline, principally because of the retirement of the baby boom generation, which would increase the number of people eligible for Social Security by more than 1/3 during the next 10 years alone. Spending for the major health care programs would increase for 3 reasons. First, because of the retirement of the baby boomers. Second, because of rising health care costs per person. And third, because of the expansion of federal subsidies for health insurance. Meanwhile, projected federal spending for all other programs put together declines sharply relative to GDP in our extended baseline. This category of all other spending has averaged about 11% of GDP during the past 40 years. It is currently about 10% of GDP, a little below the 40-year average, and would fall to about 7% of GDP by the end of the decade in 2038. By 2020, under current law, federal spending apart from Social Security, the major health care programs, and interest payments would be a smaller percentage of GDP than at any time since the 1930s. Thus, the upward pressure on federal spending relative to the size of the economy does not come from general growth in the size of the government, but instead from growth in just a handful of large programs, Social Security, Medicare, and Medicaid, and from rising interest costs on the federal debt. Federal revenues would also increase over time under current law, but more gradually than federal spending. Revenues have averaged 17.5% of GDP during the past 40 years. They are now a little lower, but will rise to 18.5% by 2023 and nearly 20% by 2038 under our extended baseline. The gap between federal spending and revenues would widen steadily after 2015. By 2038, under our extended baseline, the deficit would be 6.5% of GDP, and federal debt held by the public would be 100% of GDP, even before we account for the economic effects of that increase in debt. That would be more than any year except 1945 and 1946. With such large deficits, debt would be growing faster than GDP, a path that could not be sustained indefinitely. In our report, we separately project how the economic consequences of the policies that underlie the extended baseline would affect the long-term budget outlook. The growth in debt would reduce the nation's output and raise interest rates relative to what they would otherwise be in the long run, which in turn would lead to wider budget deficits. With those effects included, debt under the extended baseline would rise to 108% of GDP in 2038. Debt that is so large relative to our annual output would in the long term reduce output and income relative to what they would be if debt were closer to its historical average percentage of GDP. Debt that is so large would also require higher interest payments, would reduce your flexibility to use policy to respond to unexpected developments, and increase the risk of a fiscal crisis. In addition, our report shows the effects of some alternative sets of fiscal policies, some that would produce larger deficits than under current law and some that would produce smaller deficits. The report also examines the uncertainty of long-term budget projections, which is substantial. But our analysis shows that under a wide range of possible assumptions about some key factors, the budget is on an unsustainable path. As lawmakers consider changes in policies that would put the federal budget on a more sustainable course, you will face choices about the magnitude of deficit reduction, the policies to use in reducing deficits, and the timing of deficit reduction. Economic analysis does not say what the optimal amount of federal debt is, nor what the right amounts of federal spending and revenues are. But a significant reduction in debt from its current percentage of GDP would require substantial changes in tax policies, spending policies, or both. As an illustration, if you wanted to bring debt down to 31% of GDP in 2038, a little below its 40-year average, using policies that phased in over the next decade, you would need to enact a combination of increases in revenues and cuts in spending relative to current law totaling about $4 trillion during the coming decade. In deciding how quickly to reduce the deficit, you face difficult trade-offs again. Waiting to cut federal spending or increase taxes would lead to a greater accumulation of debt and increase the size of the policy adjustments needed to achieve any chosen debt target. However, implementing spending cuts or tax increases quickly would weaken the economic expansion. The negative short-term effects of deficit reduction on output and employment would be especially large now, because output is so far below its potential or maximum sustainable level that the Federal Reserve is holding interest rates very close to zero and could not lower them further to offset the impact of changes in tax and spending policies. Thank you very much. I'm happy to try to answer your questions.
Thank you. Let me start on the big picture here. We haven't solved the problem. Revenues are projected to go to, 19.5% of GDP, far higher than our average that we've been at.
Yes.
So the revenues are rising, but spending is taking off at an unsustainable trajectory, correct?
The combination of the revenue path and the spending path is unsustainable.
Right.
Whether you choose to adjust one line or the other is up to you.
Right, and what I find interesting in your report is the main driver of these outlays that are going up so fast are the healthcare programs, particularly the new
Yes.
one, the Affordable Care Act, in the first 10 years. That's the great contributor. And I find your shadow box 1.1 is very interesting, where you look at aging, you break it down between aging, excess cost growth, and then the Medicaid expansion exchange subsidies. So it's not just the fact that baby boomers are retiring. That's a big contributor, correct?
Yes.
It's also the fact that health inflation is getting out of control. It's running faster than everything else. And then when you add more programs that exacerbate those, that in lies our biggest driver of our debt, correct?
Yeah, the one amendment I would make is that health spending has outpaced GDP growth for some time, as you know.
Right.
In fact, it's been slower relative to GDP recently, but nonetheless still growing relative to GDP, and that is a contributor.
Thus, excess cost growth.
Yes.
Right. So what I find really interesting in this report is when you add an economic analysis to it, correct me if I'm wrong, but you're basically saying if we get a fiscal package in place now that let's say, take the $4 trillion number, that means we'll have lower interest rates, which will help the economy, which will grow GDP, which will lower our debt. So that's economic stimulus, using a term that my friends use, 101, meaning a bigger debt package, lower interest rates, faster growth, lower debt burden. Then lower marginal income tax rates, I find, is a very interesting aspect of your analysis. What you're saying is if we keep high marginal income tax rates, that will slow down our economy. We will not hit as much of a potential. But if we lower our marginal income tax rates, albeit on a revenue neutral basis, that will accelerate economic growth. That will help grow GDP and give us a smaller debt burden in the future. Is that basically what I'm getting out of this?
Yes, I think that's right, Mr. Chairman. The one thing I would add is that putting a package in place that gives people confidence that future deficits will be smaller can hold down interest rates today and boost the economy. That's a slightly different point than the one I made in my opening remarks about actually implementing the tax increases or spending cuts today. And that part alone would slow the economy in this economic expansion.
You're basically making a timing point there, though, correct?
Yes.
So from the Keynesian perspective, doing something that's a shock now, from a Keynesian perspective, a big spending cut that's immediate or a big tax increase that's immediate will harm and put our base in the wrong direction.
Yes.
But if we put in place a long-term debt reduction plan, dealing with these primary drivers of our debt, which are clearly these healthcare programs, there are other factors, but the healthcare programs, and if we have tax reform that lowers our marginal tax rates, that will help us in a couple of great ways. It will help us in lower interest rates, which grows the economy, and the lower tax rates will help grow the economy, which means we can get this thing under control, even with the retirement of the baby boom population. Is that basically what I'm getting out of this?
Yes, Mr. Chairman, that's right.
That's the point we're trying to make here. This is where we want to go. The reason this debt limit fight is coming is because when we've had great fiscal bipartisan agreements in the past, whether it was Reagan with Graham-Rudman, whether it was Bush with Democrats in the Senate in 1998 Andrews Air Force Base, whether it was Gingrich and Clinton or BCA and Bull Simpson, these things were part of debt limit agreements. They have always been the forcing actions that got us agreements. And what we're getting here is if we put together a package now, before the Federal Reserve normalizes, before interest rates start going, we will put ourselves as a nation in a very good position. But if we miss this moment, if we just kick the can because we keep fighting each other, then we will not get this opportunity. The Federal Reserve will start tapering. We all know that it's not a if, it's a when. Interest rates will go up, and shame on us. Because the hole we will have to dig ourselves out of then will be that much deeper. He's already giving us numbers, $145 billion a year versus $350 billion a year. And so it is so clearly in our interest as a country. This is not a Republican-Democrat thing. This is a math thing to do something about this. And what we're seeing here, it is these healthcare programs are the primary drivers of our debt. This is why we are focused on these healthcare programs. This is also why we're focused on tax reform. Because what we're getting is, if we keep high marginal tax rates, we hurt businesses, we hurt job growth, we slow down the economy from hitting its potential. If we lower our marginal tax rates, we have more economic investment. We have more entrepreneurship. Small businesses can compete. The top effective marginal tax rate as of January now is 44.6%. 8 out of 10 businesses in America, they don't file their taxes as corporations. They file their taxes as people. We call them subchapter S corporations, LLCs, sole proprietorships, partnerships, pass-throughs. The international average tax rate on businesses is 25%. Most other industrial nations don't tax themselves like we do ours. They don't have a pass-through regime like we have. They just have business tax rates, and they're on average 25%. Our corporate rate's 35. That's the highest in the industrialized world, and that's for 20% of our businesses. The other 80% go as high as almost 45% effectively. We are really hurting ourselves with these high tax rates. And so what we're getting here is if we lower our tax rates, and believe me, there's a way to do this without losing revenue. Lower our tax rates, we can have faster economic growth. If we take advantage of the moment we are in, the low interest rate moment we are in, which will not last that much longer, and get a fiscal consolidation package on spending and entitlement reform, we will do our country a big favor. We will do our children a big favor, because we will bank debt reduction and economic growth at a time where it makes the most bang for the buck, the most difference. But if we don't take advantage of this moment, this is why we're focused on the debt limit, this is why we're focused on these issues, then shame on us, because the hole we will have to dig ourselves out of will be that much deeper. I will reserve the balance of my time. Mr. Van Hollen.
Thank you, Mr. Chairman. And the whole purpose of the budget law, which establishes a process for the House and the Senate to pass budgets and then go to conference, is to try and work out these big issues on the budget deficit, not just for this year, but for future years. And the law requires that the conference committee between the House and the Senate report by April 15th. And yet our Republican colleagues have prevented us from going to conference and instead gone for a strategy where they drive this country right up against the debt limit, create huge uncertainty, and in that context try and make huge demands. If you read the papers today, they say, okay, the United States will pay its bills, but only if you adopt the entire House Republican agenda. Anti-environmental laws, get rid of the Affordable Care Act for a year. That's irresponsible. The responsible way to do it is the way the law prescribes. And unfortunately, Mr. Chairman, the Speaker absolutely refused to go to conference so we could be working on these issues for a number of years. Now, here's where we agree, that it's about math. It is about math. And every bipartisan group that's looked at our long-term deficit challenge has said, you got to look at both sides of the budget equation. Yes, of course, you have to look at the spending side, and we have to deal with the long-term health pieces. And by the way, Mr. Chairman, again, you did include in your budget the Medicare savings that we achieved without diminishing quality. After your presidential candidate demagogued against those for months on the campaign trail, but you recognized that they were important to help reduce the deficit. And in fact, the Republican budget wouldn't balance in 10 years without them. So we understand that we have to have savings on the health care side in a responsible way. But we also recognize that simple math tells you that the other side of the equation needs to be looked at as well, revenue. Now, Dr. Elmendorf, you pointed out the fact, which is that if we keep running high deficits and debt, as the economy improves, that will crowd out private investment, right?
Yes.
And that will increase interest rates, and that would slow down economic growth, right?
Yes.
And you've said that if in the next 10-year period we reduce the projected deficit by $2 trillion, then in 2035 we would have a debt to GDP ratio where we are today, right?
Yes, that's right.
And you've been clear that you could achieve that $2 trillion deficit reduction through cuts or through revenue or through a combination. Isn't that right?
Yes, Congressman.
And so if you want to eliminate that drag on economic growth, the key point in your report is that we have to reduce the deficit, right?
Yes.
And that it is up to policymakers to decide what mix. And we totally agree, Mr. Chairman, that we need to reduce the deficit, just as the CBO has said. But we think that we need to have a balanced approach, because if you do it only by cutting on the health care side, you're going to be asking Medicare beneficiaries whose median income is $23,000. And for many of them who get half of that income from Social Security, that $23,000, you're going to be asking them to take a big hit when you're not asking people who are earning $1 million to eliminate some of their deductions. Or you're not going to ask big oil companies to get rid of their special interest tax breaks, which is why we've argued, just like every bipartisan commission, that you have to do a combination of things. And that's simple math. You got to do something on the revenue side, and you got to do something on the spending side. Now, Dr. Elmendorf, as I look at your analysis here, and you look out to 2035, and you compare this year's projection to the previous current law projections, in fact, the biggest driver to increase deficits in the out years is the fact that we changed the tax law so that less revenue will be coming in. Isn't that the case?
Yes, that's right, Congressman.
Right. So the reason the deficit in 2035 is much higher under this report than in previous reports is because we changed the tax law and less revenue will be coming in. So our point is the point I think the overwhelming majority of the American people support, which is to tackle this challenge, you need to address both pieces of this going forward.
Can I ask you a question about that then?
Sure,
Are you suggesting we should raise tax rates on middle-income taxpayers, which is what we prevented from happening in that tax?
Actually, no, Mr. Chairman. In fact, reclaiming my time, our view is that your tax plan does exactly that, because you say you're going to get the top rate down to 25%. You say you're going to do it in a revenue-neutral manner, which, according to lots of analysis, means you got to come up with $4 trillion, even while you're providing the folks at the top with a big tax cut. And the way you're going to have to make it up mathematically is to increase the burden on middle-income folks. And if it's not the case, we'd love to see your tax plan. You know, it's been in the Republican budget for 3 years now. Let's see it. Just like for the last 3 years, you've been talking about repeal and replace on health care. We've had 42 votes on repeal. Not a single House Republican plan has been voted on to come up with a different system. So let me ask you this, Mr. Elmendorf, because we need to look at the long term, and we should act now to deal with it. But we also should make sure we get the economy moving more quickly. Now, several months ago, we asked you, the CBO, that if you were to get rid of the fiscal year 2013 sequester and the fiscal year 2014 sequester, how many jobs would be saved? We're obviously now not able to take back fiscal year 2013, despite our efforts to try and replace that sequester. So just for this coming fiscal year, just for fiscal year 2014, if the sequester remains in place, what's your best estimate as to how many fewer jobs we'll have in this country this time next year? 100,000? 200,000? What's your estimate?
Well, so, Congressman, if the Congress were to move discretionary funding back up to the original caps under the Budget Control Act and turn off the sequestration, for 2014. We think that would add about 0.5% to the level of GDP at the end of 2014, and it would add about 600,000 jobs at the end of 2014. Those are the midpoints of ranges. We often present our economic estimates with ranges to show the uncertainty. So the effect on GDP we think would be somewhere between 0.2% and 0.8% on GDP growth, on GDP at the end of 2014, as I said, with a midpoint of 0.5%. And the effect on full-time equivalent employment would be between 200,000 jobs and 1 million jobs, again with a midpoint of 600,000 full-time equivalent jobs.
Okay, just so I understand, your best estimate as to how many fewer jobs we will have in this country if we keep the sequester in place between now and this time next year is 600,000.
Yes, that's right, Congressman.
And just for the benefit of our colleagues, the last 3 months we've seen around 500,000, in fact fewer jobs. So you're talking about keeping the sequester in place that wipes out more than the number of jobs that were created in the last 3 months. That is an unnecessary self-inflicted wound. And so, Mr. Chairman, I would just, again, ask that the majority in this House allow us a simple vote on our plan to replace the sequester, to save over 600,000 jobs, to end the eating away at important investments, whether it's in biosciences or our infrastructure, which clearly is having a negative impact on the economy and on the country going forward. Mr. Elmendorf, let me just ask in the last minute here, if we were to actually not pay our bills, if the United States government were to lapse on its full faith and credit, could you discuss what the potential negative impacts could be on the economy?
Congressman, defaulting on any obligation of the U.S. government would be a dangerous gamble. In a very uncertain world, one thing that everyone has been able to count on is that the U.S. government will pay its bills on time. That benefit checks for older Americans, for needy Americans will go out on time. That grants to state and local governments will be paid when they're scheduled. That the bills that small and large businesses submit to the federal government in exchange for the goods and services the government buys will be paid on time, and that the principal and interest payments on the federal debt will be made on time. If the confidence in the reliability of those payments were cast into doubt, then the consequences for the budget, for the U.S. economy, for the U.S. and global financial systems could be large and lasting and very damaging.
Thank you, Dr. Elmendorf. And I noticed that you said default on any obligation because
yes,
some of our colleagues have this debt prioritization bill. We call it the Pay China First bill, which says you don't have to pay our troops in the field, you don't have to pay doctors on Medicare, but you pay bondholders, including the government of China. What you're saying is that default on any obligation would send a very bad signal.
Yes, Congressman. It's very hard for economists to know exactly what would happen. It might be that defaulting on some obligations would be different than defaulting on others. But we don't have a basis for really analyzing that because, fortunately, we've not had a lot of experience with the government defaulting. But I think given how much money the federal government owes, to stop paying what is owed is a very risky strategy.
Thank you. I'll reclaim the balance of my remaining time. To try and just put this all in perspective, and I'm not trying to pick a fight here, I'm just trying to clarify our goals and intentions. If the minority would have been willing to agree to limiting their motions to instruct conferees to 2, which was the offer given in the Senate, we could have gone to conference. That wasn't, nobody wanted that. You and I spoke about that.
No, I've never heard that offer till this moment, Mr. Ever.
That's not the case. So the point we're trying to make is, having endless motions to instruct would have done more to divide this Congress, more to prevent good, legitimate, serious reforms from making it into that budget agreement. When we have actually gotten bipartisan budget agreements in this country, especially in eras of divided government, such as one we have right now, it has usually accompanied the debt limit. We now get a report, a fresh one from CBO, which, by the way, says that there are better Medicare reforms that can lower beneficiary costs and government costs through premium support. That's a pretty interesting report. I wonder if anybody's read that. That came out about a week ago. We hear that if we lower our marginal tax rates, it's good for growth and good for debt reduction. So the problem is, can people agree that it's not just rich guys we're hitting, it's actually successful small businesses who are the job creators that help grow the economy that is getting caught up in this, and lowering those tax rates is good for jobs, investment, good for the debt. And if we get fiscal consolidation, meaning entitlement reforms at the drivers of our debt, health care programs, that too will help us get our debt under control, grow our economy, and leave the next generation better off. The final point is the window of opportunity is narrowing because interest rates are not going to be where they are for much longer. Mr. Price.
Thank you, Mr. Chairman. And I want to welcome the Director back to the committee. I think if one's looking in this country and watching this on C-SPAN today, they're scratching their head and trying to figure out why there is some agreement at the ground level that there is a debt, but why we can't come to any more agreement than that. And I really am surprised at the ranking member in his conversation about the Affordable Care Act and our focus on it. And it's appropriate because it's of concern to the American people. Thousands of stories of calamity across this country already because of Obamacare. Full-time workers being shoved into part-time status, destroying families. Amazing that this would be tolerated by the administration and our friends on the other side of the aisle. Thousands, hundreds of thousands of families with members of their families being tossed off their current health coverage because of the Affordable Care Act, not because of anything they desired as families, and this destroying lives. Huge numbers of doctors, and as a physician I can tell you, huge numbers of doctors that are no longer able to participate in the program. So I would urge my colleagues to listen to their constituents. Also, I'm surprised by the amnesia that I seem to hear from the other side. This is the President's sequester. The President's sequester. We, on our side, tried to pass a piece of legislation that would more appropriately prioritize the spending, but that was not, the administration wasn't willing to take that. And then the full faith and credit that we passed with this continuing resolution last week. But I do want to turn to your report because I find it very, very fascinating, the long-term budget outlook. This is the picture that you all chose to demonstrate the challenge that we have. And the upgoing line there is the increase in debt over a relatively short period of time that all of us can remember in our lifetimes up here. Would you call that a large and growing debt?
Absolutely.
So on page 3, you state the harmful effects of a large and growing debt, and I want to draw our attention to one sentence there. At some point, investors with a large and growing debt begin to doubt the government's willingness or ability to pay U.S. debt obligations. That's a calamitous event when that occurs, is it not?
Yes, Congressman, it would be.
And if we on this side, on both sides of the aisle, are trying to look at the tea leaves and see how close we are to that point, are there things that we can look at as indicators?
Congressman, as we say in the report, there's no way to predict when the country would reach a fiscal crisis because those events are rare, have not occurred in this country, and depend not just on some particular amount of debt, but on people's confidence in the ability of the government to manage its finances. So we don't know when we might reach that point in this country. One indicator would be rising interest rates. On the other hand, when countries encounter fiscal crises, they have often been borrowing at fairly low interest rates for a long enough time to instill some confidence, some false confidence, in the path they're on. And then rates can rise very sharply with very little warning. So this sort of event may not have the sort of leading indicators that one would hope for.
But as the Chairman discussed with you, we're still in that window where we can turn things around and move in the right direction.
Yes, absolutely.
But at some point that window closes, does it not?
Yes, it would.
I want to shift to page 88 in your report that talks about the long-run effects of fiscal policies with smaller deficits and a couple graphs. And you stated, I think, in your comments that increasing debt decreases income.
Yes.
And the graph on the bottom here demonstrates an alternative scenario where there's $4 trillion in deficit reduction over a 10-year period of time, and you actually have the debt and deficit decreasing and incomes increasing. Is that correct?
Yes, that's right, Congressman.
Can you help us understand why what the correlation is between those two?
Yes. So over time, as the government borrows more money, it is reducing the funds that are available to private investors, and thus reducing the amount of capital investment we do. And it's that capital investment that, together with education and other things, makes workers more productive and leads to higher incomes. So if there's less investment, there's less productivity growth, less increase in wages and incomes over time.
And the budget that House Republicans adopted had a debt reduction over a 10-year period of time of about,
I think, about $4 or $5 trillion, Congressman.
$4 or $5 trillion. So if we want to get on a path that decreases debt and increases income for the American people, the House Republican budget is an example of one.
Yes, it is an example of one.
Thank you. I yield back.
Ms. Schwartz. Wait, no. Ms. Schwartz is not here. Mr. Yarmouth.
Thank you, Mr. Chairman. Dr. Elmendorf, it's a pleasure
Congressman.
to see you. Thank you for being here. You know, over the last couple of months, I've talked to a large number of medical researchers, both in my district and elsewhere, who have reached near panic, I guess, over the effects of sequester on the projects that they've been working on, and very, very concerned about the long-term effects of sequestration on their work. But at the same time, they've given some very encouraging news. Virtually every researcher I've talked to believes that within the next 10 years, we will have a disruptive change in the medical field, one or more. And by disruptive change, I mean curing cancer, curing diabetes, something of major consequences to the medical field and subsequently to the burden of healthcare costs in the country. Have you, as CBO, given any thought or projection as to what, say, curing diabetes? I think the estimates are somewhere around $150 billion a year spent system-wide on that. What that kind of a disruptive change would mean on the projections of long-term healthcare costs for the taxpayer?
Congressman, our basic long-term projections don't try to guess what particular sorts of changes might occur in healthcare delivery. We have a gradual slowing of this extra cost growth over time in response to rising pressures of costs. We don't try to figure out the path for particular sorts of diseases or treatments for them. Whether curing a disease would help the federal budget or not is actually not very clear. It would be great for people's lives, obviously, but the effects in the budget are complicated. When we looked at the effects of raising the cigarette tax in a lengthy report that we did, that would make people healthier. Fewer people would smoke. They would live longer. But the federal budget has some odd cross currents. There's less spending on health care for people who don't get certain diseases. People live longer. They collect Social Security benefits for longer. That's all to the good for society, but may not be good for the federal budget. So for individual diseases and individual new approaches, there could have different sorts of effects on the federal budget. And we've not tried to work out any of those in great detail, except, as I said, for this increase in the cigarette tax and reducing smoking.
Thank you. Let's kind of look at it a different way. You talked about the fact that $4 trillion in reduction of either spending, or a combination of reduction of spending and increased revenues would bring the debt as a percentage of GDP to below historic ranges. So we're talking basically about, what, $400 billion a year?
Yes, that's right.
At current levels.
Yes.
What would be the impact on the economy of taking $400 billion out of the economy, say, in the healthcare arena? $400 billion a year.
Well, if one takes it out of the economy right away, and especially under these economic circumstances, it would weaken the economy. It would reduce the number of jobs. That's why many people who have constructed different policies for reducing deficits have focused on phasing in those policies over time. And again, back to the discussion we had earlier, there are pros and cons of how quickly one phases in policies. I think a general agreement that making decisions soon is good, because the sooner you make decisions, the more time you give people to plan and adjust to where policies are going.
All right. Thank you. The chairman of the committee talked about and stated it as apparently a matter of faith or irrefutable faith that cutting marginal tax rates creates wealth and reduces the deficit and so forth. Didn't we try that in 2001 and 2003?
Well, Congressman, I think that the economic statement, I should say carefully, is that reducing marginal tax rates while maintaining the same level of total revenue so that deficits would not be affected would be good for the economy. If one lowers tax rates and loses revenue through that process, then the effects on the economy depend on the magnitudes involved, because the larger deficits are bad for the economy and the lower tax rates by themselves are good for the economy.
But we did reduce marginal tax rates in 2001 and 2003, and
Yes.
we did not see a reduction in the deficit over the ensuing years. Is that correct?
Congressman, I think when economists study the effects of changes in tax rates, we don't look at just a few years. There's so many things go on in the economy and the budget, so we draw on a broader set of evidence.
Great. Thank you. I'd yield the last 25 seconds. Okay, never mind. I'll just yield back the balance of my time.
Mr. Garrett.
Doctor, appreciate your coming in to testify. So, as Dr. Price was saying, the viewers who watch this probably can see the difference of opinion as to whether we're in a financial difficulties or not. Looking at the issue of health care, we see the discrepancy on that view. So I appreciate that you're here and the report as well, because we can sort of dig down into some of the numbers. In the report, I believe I read that the balance of the trust fund under Medicare, looking at that part right now, Part A, would fall from $229 billion at the end of fiscal year 2012, last year, to $31 billion at the end of fiscal year 2023. Is that correct?
Yes, Congressman.
Okay. And then you go on to say, the CBO concludes that in the long-term budget outlook, what we're talking about here right now, is a, quote, under the extended baseline, the trust fund would be exhausted just beyond the coming decade. Is that correct?
Yes, Congressman.
Okay. So I guess my constituents at home, I don't know whether they read this report or not.
But I hope they do, Congressman.
Yeah, I hope they do, too. There's a lot of pictures and everything. I mean, it's a little dry, but it's important. But they do get your message, and they do get your numbers, and that's why they are asking us, what are we doing to try to fix this? You use the word exhausted. What they're asking me is, what are we going to do to prevent bankruptcy, by another way to describe exhausted, I think. Could you tell us, or tell them, what will be the practical implications for seniors in my district and across the country as well, if we get to that point where Part A is exhausted or bankrupt, if you will?
So, as you know, Congressman, the payments for hospitals through Medicare come out of the Hospital Insurance Trust Fund. If that trust fund were exhausted, then the amounts that could be paid to hospitals for treating Medicare beneficiaries would be limited to the amount of revenues as they come in, and that would be less than would be needed to meet all of the bills that would arise under current law.
What does that mean to a senior at home today, if that happens?
Well, we have not, so far, the Congress has not let either the Medicare or Social Security trust funds actually run out of money. But if Congress were to stand by when that happened, then hospitals would not get the payments written down in current law. I don't know which hospitals would get paid or which wouldn't, or for which patients, or what patients would not get paid for. We have no way to know.
Okay. And so now the bottom line, doctors potentially would not be paid, hospitals potentially would not be paid, or more than potentially, and services.
So hospitals would not get the full payments that
Right.
they're written into current law. That's right, Congressman.
So just delving into that a little more, also in the report it says the federal government's health care spending will grow considerably in 2014 because of changes made by the Affordable Health Care Act. What are the growth projections for health care spending as a result of the Affordable Health Care Act, as a percent of GDP as well?
Well, Congressman, all told, the federal spending on these major health care programs is about 4.5% of GDP now. We think it'll be 8% by 2038. And over those 25 years, there are substantial portions of the increase explained by the aging of the population and rising health care costs, and by the coverage expansions of the Affordable Care Act.
Okay, so spending is going to go up. The services would be going down. Now, there's an article in the Wall Street Journal recently about the price of the premiums that people will be paying. In my home state of New Jersey, it says in New Jersey, premiums would increase from $162 per month, right, to $219 per month. I just did that. It's around 35%, roughly, increase in premiums under the Affordable Health Care Act if we just continue on right now. I know you guys did a look back in 2009 as far as the increase of premiums. Have you done a look at what premiums would be increasing under the Affordable Health Care Act if the status quo is continued?
So you're right, Congressman. In the fall of 2009, we did analysis of what the version of the Affordable Care Act in play at the time would do to premiums. We've not updated that. We are, of course, following the news about premiums, and we will factor them into our next baseline projections. We've not redone that particular analysis.
You haven't redone it, but do you still expect that the Affordable Health Care Act would increase premiums for Americans purchasing in the non-group market?
Yes, Congressman, let me explain clearly here. We thought there were a number of factors that would increase premiums, the most important of which, in our estimation, was insurance policies will be required to cover a larger share of the total services. That means that premiums would be higher, but out-of-pocket payments would be lower.
Right, and that's a part of the Affordable Health Care Act.
That's because of the Affordable Care Act, setting standards for what share of medical costs had to be covered by an insurance policy. But the increase in premiums and reduction in out-of-pocket costs will be offsetting for the average beneficiary. Some would pay more, some would pay less, but offsetting on average. And there are other reasons also why we think premiums would go up. And as you know, those are before subsidies, the premiums that you're referring to.
Right, and my time is up, but I thank you for the clarification on all that.
Thank you, Congressman.
Mr. Pasquarello.
Thank you, Mr. Chairman. Mr. Chairman, I'm glad that you're the chairman here. I'd rather have Chris, of course, but I don't want to believe, I really don't want to believe that we have this obsession with the debt. And no one in this room denies, just looking at the pictures, that we have a debt and we need to address it. The question is, how do we address it? And we don't address it by making it worse. It's like folks that look back to 2009 and they see the great deficit that existed in 2009 because no business was investing, no capital, no consumers were buying, so the government has to do something, as they've done in 25 times in the 20th century whenever we had a recession or a depression. So I like to put things in context. So I'm counting on you. So you won't allow this issue to be a stalking horse for continued ideological struggle to slash the social safety net and pad the pockets of other people. I'm counting on it. I can't put it any clearer than that. We're talking about this budget, and we're talking about the debt.
Can I ask you, do you honestly think that's what we're trying to do?
No, I said I'm counting on you. If you want me to go around to the rest of the members.
No, but you're addressing me. I mean, honestly, do you honestly think that's what we're trying to do?
Yeah, I think that's one of the reasons that we have the problem today.
Well,
I don't think that's your motivation. Who am I to question your motivation? But I don't think that's where you're at. So I'm counting on that. But on page 103, the very large change between this year and last year, correct me if I'm wrong, in the projected federal debt stems primarily from changes in tax law that have sharply reduced revenue, future revenues.
Yes, Congressman.
That's on page 103. In this report, the largest reason for the deficit would be bigger than the previous estimate that we've had, is that the tax deal we had at the beginning of this year, talk about amnesia, and that deal is very interesting to examine. How much bigger, Mr. Elmendorf, would the deficit have been if we had extended the tax cuts of 2001 and 2003 for everyone, as my friend suggested on the other side? How much bigger would the deficit, since they're so concerned about this deficit and debt, how much bigger would it be?
It would be substantially larger, Congressman, but I don't have a numerical estimate at hand. I'm sorry.
Substantially larger.
Yes, Congressman.
And then what do we do? So, in just 1 year, the projections for the future growth in our healthcare system went down by almost 10%. I read parts of this report. That's what you say, correct?
So we brought down the
Yeah.
Yes, Congressman.
In all the other years before that, since 1995, going back to 1990, those costs went up. Now, maybe it just happened by chance. Maybe we woke up one morning and said, well, insurance companies felt great and said, we won't increase the premiums as much as we did last year. You know that's not how it happened, and I know that's how it happened. I don't know if everybody in this room knows that's how it happened. So, it's clear that I have much more to do, but this is a very significant accomplishment because so much of this deficit is dependent upon, as the chairman rightfully pointed out, health care costs. The purpose of the ACA, one of its purposes, was to bring down the health care costs. Now, Dr. Elmendorf, on page 58 of your report, you make some projections regarding federal non-interest spending, including discretionary spending,
Yes.
which we know is coming down. The President lowered it by half. The reason why I lowered it by half, someone said this morning, well, how can you say lowered it by half when he increased it so much in 2009? Put it in context.
Thank you. Mr. Camp, where are we? Mr. McClintock.
Thank you, Mr. Chairman. Dr. Elmendorf, we keep hearing the proposition that in order to reduce the deficit, we either have to raise taxes or cut spending. But as if taxes and deficits are opposites. It seems to me they're the same side of the same, or they're two sides of the same coin, that deficits are taxes. They're just future taxes. The only question between the only difference between a deficit and a tax is the timing of the tax. Is that?
Well, I think, Congressman, a deficit could be, the accumulation in debt that comes from a deficit could be addressed later by a tax increase or by a spending cut later. I think with a deficit, what a larger deficit does is to, push the question off for the future.
But you're applying future taxes. I mean, taxes and deficits are the only two possible ways to pay for spending.
Yes, Congressman, that's right.
Well, so it seems to me then that the critical issue before us is the level of spending, since the level of spending automatically sets the combined level of current and future taxes, not the other way around.
Well, again, I think it can affect future spending as well, but I take your point that the only way to pay for spending is to collect that in revenue or to borrow that money.
A recent article in the Wall Street Journal noted that the European experience is that those nations that have restrained spending increases relative to GDP overall had higher economic growth than those that did not. Is that your observation?
I think, Congressman, it depends on the time period you look at and on the sets of policies. So the countries in Europe that have had more restrained fiscal policies in the past few years have not had good economic growth. They've had weak economic growth.
When you say restrained fiscal policy, that's
countries that have had lower spending.
Taxes and spending.
Countries that have had lower spending or higher taxes.
What the Wall Street Journal article was referring to specifically was levels of spending relative to GDP, and they found a remarkable correlation between restraint and increases in spending relative to GDP and economic growth.
So, Congressman, I think the way that economists would look at that question is to look at the effects that the tax code of a country is having on people's behavior.
But again, their point is it's the spending that seems to be directly correlated to growth. The greater restraint in spending, the greater overall economic growth these nations have had. You mentioned timing. I mean, just looking at the recent history of this country. Coolidge, Truman, Kennedy, Reagan, Clinton all cut spending relative to GDP. Hoover, FDR, Johnson, and Bush all increased spending relative to GDP. The economy seemed to do better under the former policies than the latter.
Well, Congressman, President Hoover, for example, not to defend his economic policies exactly, but GDP started to fall. Spending rose as a share of GDP, simply because of what happened to the economy, not what happened, not originally a budget decision. But just in terms of raw federal spending,
he increased spending 60% during his 4 years in office. I'm just
noting that the ratio of spending to GDP depends both on explicit decisions about spending and also
but even factoring that out, just in nominal terms, 60% increase in federal spending in 4 years is rather breathtaking, and it didn't seem to jumpstart the economy.
Let me go on. Most economists think that expansionary fiscal policy in the Depression, meaning meaning larger deficits, was good for the economy during the Depression.
Yeah,
And most economists think that the lower taxes and higher spending this past economic downturn were good for the economy during the downturn. The problem is the longer-term effects.
I understand that. That's an example of what I like to call McClintock's third law of political physics, which is the more we invest in our mistakes, the less willing we are to admit them. But let me go on to a response that you made to the ranking member who asked you about the debt limit. Did I understand you correctly to say that you see no distinction to credit markets between the government defaulting on actual debt owed to the public and delaying payments of routine obligations? Did I understand that correctly?
No, that's not what I said, Congressman.
Good.
I said that defaulting on any obligation of the U.S. government was a dangerous gamble.
But
I said that, Congressman.
Do you believe that credit markets see a distinction between defaulting on the actual debt owed to the public and delaying payments of routine obligations?
And I said, Congressman, that it might be that the financial system or the economy would respond differently to default on different kinds of obligations, but that economists did not have a basis for making analytic predictions because we don't have experience.
I want to turn to one other subject very briefly, student loans. $1 trillion of debt owed to the federal government, increasing default rates. The amount that we're putting in seems to be driving a huge increase in tuition. Tuition is up 4 times the rate of inflation over the past decade. Health care up twice the rate of inflation, yet we talk about affordable health prices. Are we heading toward a student loan default bubble?
Thank you. I have to get back.
We haven't studied that, Congressman.
I just want to keep everybody on time. Ms. Castor.
Well, thank you very much, Mr. Chairman. Good morning, Dr. Elmendorf. Thank you for being here, and thank you for all of the work that went into the 2013 long-term budget outlook. I'm very concerned with the economic damage that's being caused by the sequester. And you previously responded to Ranking Member Van Hollen by saying, did you say if we keep the sequester in place, that could cost our country 600,000 jobs?
Yes, relative to the alternative of moving discretionary funding back up to the original BCA caps and not having the sequester take effect.
And that would take, did you say, a ½ point away from gross domestic product?
About 0.5% off of gross domestic product by the end of 2014.
And you know, back home in Florida, in my community, the type of jobs we're talking about, I think we've already seen some very harmful impacts. Our premier cancer research center in Tampa is the Moffitt Cancer Center. They, before the sequester, had 120 researchers working to find the cure for cancer and work on treatments. They're down to 100 researchers. At the Air Force Base, MacDill Air Force Base, it's one of our largest community economic drivers. They are furloughing mental health counselors, among others. We all agree that defense is, that part of the budget is shrinking, but the sequester does not give us a lot of room to maneuver on the type of where we want those cuts to take place. Law enforcement, job losses, cuts to the courts, very significant cutbacks in education. And then when the Republicans adopted the CR last week, it became crystal clear, I think, that they intend to march forward with those sequester cuts. And I think, you know, then I look at your report, and it's apparent those kind of expenditures aren't the drivers of the long-term debt. Is what America is investing right now in innovation or infrastructure or education, are those the drivers of the debt and deficit?
No, Congresswoman. All government spending, except for spending for this handful of large programs, will be a smaller percentage of GDP by the end of this decade than it's been at any point since the 1930s. What is growing in dollar terms and relative to the size of the economy is spending on Social Security and Medicare and Medicaid in particular. And Congressman, I would just add that of non-defense discretionary spending, historically nearly half has been an investment of some sort. About 20% of that spending has been gone to physical capital. Think of building highways, for example. About 15% has gone to education and training, what economists would call investment in human capital. And about 10% has gone to research and development, like health research. So historically, nearly half of this category of non-defense discretionary spending has been an investment of some sort.
Well, then we have a real mismatch here now on what the Republicans have enacted and have set forth in debate, just last week on the CR, on what the debt reduction strategy is. You want to continue the sequester. Meanwhile, the CBO's report says the long-term drivers of the debt and deficit, an aging population. We have proposed significant reforms in Medicare. Just look at the Affordable Care Act. A lot of those reforms, taking Medicare from fee-for-service to a system based on quality, changing those models. We really need to sit down and negotiate. The Republicans' refusal to negotiate on the budget for the past 4 months has led to this mismatch in policy. I talk to many of you, my Republican colleagues. They say, yes, I'm sorry, we want the sequester, we want these cuts. But I hope you really study the CBO's report and understand it's not those investments in innovation, education, infrastructure in America that are driving the long-term debt. I'll yield back.
Ms. Langford.
Thank you. Dr. Elmendorf, thanks for being here as well. Let me just bounce to a couple different issues if we have time on it. Social Security Disability, SSDI. What is your report on that as far as the status of that and where it's headed in the coming days?
So the Disability Insurance Trust Fund will be exhausted in just a few years, Congressman, I think in 2015 or 2016, I'm told. We think that trust fund will be exhausted in 2016.
So we have 3 years.
Yes, Congressman.
And what's the status at that point once that's exhausted?
Once that trust fund is exhausted, as with the Hospital Insurance Trust Fund, then the payments can presumably be only as large as the incoming receipts, which are not enough to cover all of the payments that the government is committed to under current law.
Has that changed as far as the growth of that program in the days ahead? What's brought about that moment? Is that date changed, 2016? Did it used to be 2020? Have you been able to determine the history of that?
The date has moved, our projection of that date has moved around over time. As you may know, Congressman, the disability insurance rolls have increased markedly over the past few decades, and we've done a number of reports ourselves trying to show you what the sources of that increase are and to give you policy options for addressing it. It's in the last few years, it's been pushed up in particular, I think, by people who have had trouble finding, who have some disabilities, have lost their jobs or trouble finding jobs and have applied for disability insurance.
Are you aware of Congress implementing any of those policy options that you have recommended in the past?
No, Congressman.
You think it might be time for us to implement a few of those?
I think it'd be, I hope that you find these options useful for you as you decide what policies to follow.
At some point, when we begin to solve some of these issues, let's say, is that the first entitlement to reach an insolvency level, is the disability?
So that's the first of the, as you know, only a few of these benefit programs have trust funds of this sort, and that is the first of these that, of these benefit programs that would reach
If we implemented some of the policy options, and we can discuss some of those in the days ahead, but if we implemented any of those policy options, how many years would it take to bring some stability to that? So what I'm trying to ask is, the clock is ticking. We have 3 years before we're insolvent. If we implemented that policy at the end of this year, would that buy us another year, depending on what it might be, or would it take several years to be able to get into the system to build it up?
So in principle, of course, you could make very sharp changes overnight, but in practice...
Yeah, we could add a lot of tax dollars to it, or deficit dollars, and say we're just going to continue to fund it that way with deficit.
Or in principle, you could just cut benefits a lot for existing beneficiaries. But I think in practice, the point you're making is that Congress generally makes changes that are phased in over time. And that emphasizes the importance of deciding as soon as possible what changes you want to make. Because if you want to phase them in, then, and you need to forestall the exhaustion of a trust fund, or you want to forestall a given increase in debt, then it's even more important to make decisions and start that process right away.
Okay, on page 64 of your report, you make a pretty remarkable statement about the tax revenue that's going up, and you say that the tax revenues you project is going up because of the growth in real income and the interaction of the tax system with inflation would push a greater proportion of income into higher tax brackets, and certain tax increases enacted in the Affordable Care Act would generate increasing amounts of revenues relative to the size of the economy. Is this similar to what we faced with the AMT for years, that because it wasn't inflation adjusted, we had a growing number of people that were caught into that AMT trap?
It is similar, not as dramatic as the AMT increase would have been. The AMT was not indexed for inflation, and moreover, the Congress enacted a series of these temporary changes.
Correct.
So that the jump got larger and larger. Jump to the under current law got larger and larger over time.
Is there an assumption at all
idea.
in some of your conversations that that may occur again at some point, since it was in your alternative fiscal scenario that there would be an extension of the AMT? Is there a discussion to build into an alternative fiscal scenario that Congress will, again, not allow more and more people to be trapped in these higher taxes in the days ahead?
Yes, our alternative scenario, which tries to extend policies that Congress has extended in the past, or not let certain things take effect or be sustained that might be hard to sustain. One of the things that scenario includes is holding tax revenue at a lower level indefinitely rather than rising. And in the past, Congress has tended to act to cut taxes when tax revenue got to be a larger share of GDP.
On page 88, you talk about how if the deficit comes down, the graph that Dr. Price had mentioned earlier, when the deficit comes down, people's real growth and income goes up. And you made a stark statement earlier about it, and that was that when sovereign debt is requiring more and more of those individual dollars to come out, it's less money that goes into capital investment. And so that slows the economy down some and the real growth of that. What's interesting to me about it is the assumption then is private dollars going into investment has a greater increase on the economy than government dollars taking that and quote unquote investing that into the economy.
I think our view, Congressman, would be that investment does good things for the economy. A lot of investment, of course, most investment occurs in the private sector. There can be government investments that pay large dividends over time. We haven't modeled that effect specifically in this analysis.
Thank you, Dr. McDermott.
Thank you, Mr. Chairman. It's always good to have an economist here. Welcome, Doug.
Thank you, Congressman.
I put a chart up on the screen because I want everybody to see it. It's one of your charts. And in late 2010, the fiscal commission that we've lionized, the Bowles-Simpson, called for roughly $400 billion in health care savings in their original proposal. Now, since that time, however, CBO has reduced Medicare and Medicaid projections by roughly $1 trillion, more than twice as much as they suggested. Is that correct?
Yes, Congressman. Actually, about a $1.25 trillion reduction in our projection of spending for these programs.
So that would suggest that the chairman's blaming of all our deficit on health care spending is really not quite accurate. We are actually reducing it, and it is certainly questionable as to whether that is going to be the major cost of our deficit in the future, isn't it?
Well, Congressman, our projections of the growth of healthcare spending have come down. Nonetheless, as you know, in our current projections, the growth of healthcare programs is the largest factor leading to higher spending and wider deficits over time. And we showed in the report a sensitivity analysis to our projection of healthcare spending growth that shows that even if growth is a good deal lower than we project, the debt would still rise relative to GDP over the next 25 years.
So there's just too many people living too long. Is that what you're saying?
Well, I wouldn't say too many people, but there are a lot of people living longer, and that increases the number of beneficiaries of Medicare and of Medicaid. As you know, a large share of the Medicaid dollars go to older Americans, particularly for longer-term care.
So if we cut off the spending at the federal level for the people who are on the program, how will their care be paid for, or will they simply not have care?
I think it depends on what you did, Congressman, but as you know, many older Americans do not have substantial financial resources, and if they suddenly faced a larger burden to purchase health care, that would affect the care they could buy or the other necessities they could buy.
Or they turn to their children.
Yes, Congressman, that's possible too.
As it was before 1964 in this country, when old people didn't have health insurance, they turned to their kids. And that's what my grandmother did. She came and lived with us, and we paid her bills, right? That's what went on before this program. So what they're talking about, when they want to cut Medicare spending, they're really saying we're going to cut what the government will spend for old people, they can find it wherever they want after that. They can go to their children, or they can go out and beg in the streets, or not have the care. Is that?
So, Congressman, I can't speak to what the they in your sentence
Okay.
want to do.
Well, I want to look at your chart on page 10. It's really, I mean, since we're blue skying in here about 75 years, I want to look at that chart and ask you a question that Ms. Custer sort of moved toward, which is we're not making investments now. Now, if you look at the Civil War, during the Civil War, Abraham Lincoln started the land-grant colleges, he did the Homestead Act, he did the national railways. That looked like reckless spending to me. Why would you do, when you have a big spike, and then you come to the Second World War, and we come out of that, and we have the GI Bill, and we have FHA, and we have VHA, and we have the federal highway system under Eisenhower, all reckless spending by our presidents at that time. Now, why was it the country didn't go into default or disappear from the face of the earth? Because of this reckless spending that had been done by these presidents.
Well,
how did it work?
So,
you're an economist, so give us an explanation.
So I'm less familiar with the post-Civil War period, but after the Second World War, Congressman, the government roughly balanced its budget, and the economy grew rapidly. So the ratio of debt to GDP fell sharply.
Where were they getting the money to give these scholarships to every guy who came back from the military? Practically was all men. They handed out the GI Bill of Rights. Where did that money come from?
The federal government raised tax revenue roughly equal to the spending that it was doing.
Well, they raised the tax revenue and did that. They were investing in the people. Is that what created the greatest generation, do you think?
Well, I think the government investments played some role, Congressman, but I don't know how important they were relative to other factors. I really don't.
And where did they get the money for the highway system?
Thank you. Mr. Flores.
Thank you, Mr. Chairman. Director Elmendorf, thank you for joining us again today.
Congressman.
There were a couple of comments that came from the other side that we need to correct. They just don't need to hang out there. I'd remind Ms. Castor that the sequester was the president's idea. If she doesn't like it, I can give her a phone number to take care of.
Well, the gentleman
to call. The next thing has to do with some of the comments from the ranking member.
Plan 8 times.
Madam, this is my time. I didn't interrupt you. The other comments had to do with Mr. Van Hollen. He said that we've done nothing about the sequester, but unfortunately he is incorrect. We have tried in the House to replace the sequester more than once. The other comments about
the gentleman yield on that? Because that's not what I said.
Yes, you did.
No, I said you hadn't taken action this Congress.
So, and the other thing I'd like to say is that the comments about Republicans talking about shutting down government are incorrect. You have not heard one comment on this side of the aisle about shutting down the government. Those are irresponsible and reckless comments. One of the things we've heard is that we need to raise taxes. And I'd refer you to page 80 of your report. And it says that increases in marginal tax rates on labor and capital income would reduce output and income relative to what would be the case with lower rates, all else being held equal. For example, a higher marginal tax rate on capital income decreases the after-tax rate return on savings, weakening people's incentive to save. Less saving implies less investment, a smaller capital stock, and lower output and income. So, I mean, you stand by those comments, don't you?
Yes, Congressman.
Okay. Well, I just would like to remind the other side of the aisle that for all this furor about wanting to raise tax revenues, that they could damage the economy in doing it. Let's kind of move to the real world for a minute, and let's talk about Central Texas for a second. If the government has a policy or a law that increases health care premiums by 15 to 20% per year, is that good or bad for employment and economic growth?
Congressman, I think it depends on the policy.
Okay.
I really don't think there's a blanket answer to that question.
Let me tell you what the answer is, because the employers in my district are telling me it's bad, and they've told me about what has happened to their past head counts and what's going to happen to their future head counts. What if we had a policy or a law that causes employers to reduce the number of full-time employees by reducing their maximum weekly hours to something less than 30 hours per week? Is that good for employment and GDP growth or bad for employment and GDP growth?
So, Congressman, the Affordable Care Act does include some incentives, as you know, for employers to move toward more part-time employment.
Well, let me give you the real-world answer.
The total amount of labor is not clear.
Our employers in our district say that it's bad for employment. How about federal regulations that cause the price of energy to skyrocket? Is that good for the economy and GDP growth and employment, or is that bad for it?
Higher energy prices tend to slow the economy, all else equal, Congressman.
Thank you, Mr. Chairman. I yield back.
No? Wow. Ms. Lee?
Good to see you again, Director. Let me ask you a couple of questions. I'll go right to them. First of all, last week, as we all know, House Republicans cut, I think, about $40 billion from the SNAP funding. Many of us believe this is morally wrong and deeply troubling, especially considering nearly 1 in 5 children in America suffer from food insecurity, and nearly half of all SNAP recipients are children. $40 billion in cuts means 6 million families will be cut off from this vital economic lifeline. And at a time when so many are already struggling to stay afloat, this is, for me, very mind-boggling. It's unconscionable and it's wrong. There's certainly no rationale for throwing hungry children, families, and seniors off of SNAP. And I can't conceive of any compelling economic rationale either, given that for every $1 in SNAP benefits, I believe it's $1.70 generated in economic activity. So I just have to ask you, in terms of the economic benefits to SNAP spending, does CBO estimate the current economic impacts of these types of cuts in basic nutrition on the health care costs in the future? That's my first question. And then secondly, has to do with the public option. I believe that I think it was 2011, CBO and the Joint Committee on Taxation estimated that a public option would reduce the deficit by about $88 billion between 2012 and 2021. Given that the Affordable Care Act at passage saved about, I think, $140 billion, and now it would cost about $109 billion to repeal, what do you think, from a fiscal point of view, a public option would achieve in terms of, had we included them in the exchanges, what would be the downsides or upsides fiscally of the public option?
So, Congressman, on your first question about SNAP, our estimate of the legislation that passed the House was that it would reduce the number of people receiving SNAP benefits by about 4 million in 2014 and about 2 million in 2023. And we have said a number of times in the past that people receiving SNAP benefits or other benefits of this sort have a high propensity to consume, to spend the money they receive. And thus, that providing them with more money tends to be a short-term boost for the economy, and taking money away from them would tend to be a short-term drag on the economy. We've not done an economic analysis of this particular piece of legislation. On your second question about a public option, as you were reporting correctly, our estimate from our last volume of a set of budget options, and we think that including a public option in the insurance exchanges would bring down federal spending. That estimate was, as you say, about $90 billion over 10 years. We've not updated that estimate since that point, but we have no reason to think that it would be markedly different today.
Thank you very much, Mr. Chairman. I yield the balance.
All right. Mr. Ridgel is here? No. Mr. Rokita.
Thank you, Mr. Chairman. Thank you, Director. Good to see you again.
Congressman, good to see you.
I want to go down and unpack this idea that the sequester is hurting the economy and killing jobs and so forth. Do government jobs better the economy?
Yes, Congressman.
How?
Because if the government pays people for working, they then earn money they spend by buying refrigerators and cars and clothes and other things. And then those
where
people
does the government get the money to pay that initial person?
Well,
where does the government get the money to pay you and me?
So under the current circumstances, as you know, any extra spending comes from, if you just raise spending, the government would borrow that money.
No. Don't just, where does the government get the money to pay you, me, and the hundreds of thousands of other workers that you say, if we're laid off, would hurt the economy?
So it raises some of that money through tax revenue, and it borrows some of it.
So it confiscates that money from people in the private sector, correct?
It raises some of the money through tax revenue.
Which is a confiscation of property, correct?
Those have to be your words, Congressman. They're not
fine.
Budget terms.
We take money from the private sector to fund the jobs of the government like you and me, right?
You raise tax revenue and you
Right.
borrow
No,
money.
now we're borrowing too. About 40% of our federal budget's borrowed, of course, from people that don't yet exist. So it is a tax on them whenever we pay that
It's
debt.
borrowed from people who certainly do exist and send in the money and provide the cash.
Well, the
but
debt,
you may
yeah,
pay
but
it
the
back.
debt created by
on the-
that
you
is
may pay
eventually
it
gonna
back
be paid back by
don't-
people who
not
are
yet
around when you and I are dead, right?
That may be. It depends what policies.
Well, you probably
pursue.
run a lot more in the morning than I do, so maybe you'll live longer. But the point is that to run the government, to pay people for these jobs, or to pay people who work these government jobs, we take from somewhere else. We take from the private sector. So that is less property, less money, right, that they have to grow the economy. How much, so you obviously don't agree with me, how much does the economy grow by paying all these people in government jobs?
So, Congressman,
you say that government jobs help the economy. To what extent? What percentage?
So I'm not sure what the policy experiment that you had in mind is. Is the alternative no government, or is it a reduction?
I'm asking you questions.
But I can't answer, but I don't understand the question.
How we started this off was you said that the economy grows with government jobs. To what extent? How much? How do you quantify that?
So it depends on the economic circumstances. In an economy where there is sufficient demand for goods and services, that essentially all of the productive capacity is at work, which was true in this country in 2007, for example, then additional government job is likely to come out of a job in the private sector. However, if the demand for goods and services is less than the productive capacity of the economy, which has been the case in 2009, 10, 11, 12, and 13, then additional government borrowing that is then spent to hire government employees or to provide benefits will increase the output and employment in the economy. And that is a very widely held view among economists.
If that's the case, why don't we just tax everyone 100% and borrow more so that we can grow the economy? That would be a surefire way to make sure GDP increases, right?
So, Congressman, it is not true at every tax rate. I'm speaking about the economic situation in the country today, the tax system we have in the country today.
So
given where we are now,
temporarily 100%, borrow more temporarily, and then?
No, Congressman, tax rates of 100%, as you well know, would
I don't believe that when you
drive down private activity
from the private sector to fund government jobs that you actually grow the economy. So we've already established that you and I have a difference of opinion. So yeah, I don't well know. But you well know that but because of what you said, that you grow the economy with all these government jobs, and I'm trying to quantify that, what you mean, and understand why we shouldn't do more of this borrowing, more of this confiscation of the people's property in the form of taxes, to better ourselves, to just get ourselves right out of this hole.
So, two thoughts, Congressman. One, on behalf of my opinion, there was a survey of economists conducted by a group at the University of Chicago about whether, conducted of economists, leading economists across the country, about whether the Recovery Act had made output and employment higher than they otherwise would have been. And 88% of the respondents said yes, 4% said no. So my opinion is widely shared. On the second point,
by Keynesians.
This was a survey of economists,
I see that I'm out of
leading
time,
economists
Thank you.
across the country. On the second point, Congressman, the best quantification I can give you is the one I started with in response to Congressman Van Hollen's question, which was an estimate of the effects of continuing versus not continuing with the sequestration for 2014.
Chairman, I'd simply say the sequester is not the problem.
Thank you. Mr. Jeffries.
Dr. Elmendorf, under the 8 years of the Clinton administration, the so-called confiscation tax rate was 39.6%. Is that correct?
That was the top tax bracket, Congressman, yes.
Right. And under this confiscation rate, approximately 20 million jobs were created in America. Is that correct?
I don't remember the number, Congressman, but it was quite a few. It was a tremendous economic boom.
Okay. And now during the 8 years of the Bush administration, which immediately followed the Clinton administration, am I correct that the so-called top confiscation rate was dropped to 35%? Is that right?
Yes, Congressman.
And we lost approximately 600,000 jobs during that 8-year period. Is that right?
I don't remember the exact number.
Okay. Now, as it relates to a statement that was made earlier by one of our colleagues who suggested that the American people looking at this hearing might come to the conclusion or be perplexed at our inability to move forward with a resolution, because I think we all agree that there's a long-term deficit and debt problem that we need to confront. I would certainly agree with the ranking member and his observation that perhaps the problem is that we've breached the procedural integrity of the budget process, that the House has passed the budget, the Senate has passed the budget, and the next step in that process is to move forward with conference committees. Because the math that we should really be paying attention to preliminarily is the electoral math. And the electoral math says that we're in a divided government context, and that there are 54 Democrats and independents in the Senate, which constitute a majority. That Barack Obama did win re-election with 51% of the vote, only the second president since Eisenhower, I believe, with 2 consecutive popular vote margins to exceed 51%. We're in a divided government context. We should move forward with the integrity of the process, which is conference committees, so we can work it out and perhaps try and find common ground to move things forward. Now, you stated, I think, in your testimony that the consequences of default on the debt would be large, lasting, and very damaging. Is that correct?
I said that economists are unsure, but they could be large, lasting, and very damaging, and that's why I think it's a dangerous gamble to default on an obligation.
Right. I think you said it was a risky strategy to stop paying what the United States government owes. True?
Yes, Congressman.
Now, part of the problem with a default on the debt is that it would erode the confidence of investors in the belief that the United States has the ability to manage its economic affairs. Is that right?
Yes, Congressman.
And one of the reasons why Greece and some of the other European countries, which many of our colleagues love to allude to, find themselves in the situation they're in right now is because there was an erosion in confidence in the ability for those countries like Greece to manage their economic affairs, correct?
Yes, Congressman.
And one of the consequences of that erosion of confidence is that the rates on our debt moving forward would increase perhaps quite significantly. Is that right?
They could, Congressman, yes.
And so an erosion of confidence then leads to an increase quite possibly in our debt burden, and the increase in the debt burden worsens our long-term budget outlook. Is that right?
Yes, Congressman.
And that's part of the reason why I think it would be irresponsible to simply attempt to hold hostage the full faith and credit of the United States of America in the context of us paying our bills as we confront the need to raise our debt ceiling. And I hope that this Congress will come together and stop playing partisan politics as it relates to this very serious issue. One last question in the remaining time that I have. Would it be fair to say that an increase in the minimum wage largely benefits low-wage workers?
Yes, Congressman.
And low-wage workers are most likely to immediately spend the increased income, is that right?
I think that's right, Congressman. There are but people who work and receive a higher wage would have higher income that they'd be likely to spend. As you know, there are higher minimum wage can also reduce the number of people who have jobs.
Right. Now, that increased spending and increased consumer demand would ultimately lead to economic growth. Is that correct?
Under the current economic conditions, an increase in the demand for goods and services would boost output and boost the number of jobs.
Okay, thanks. I yield back.
Thank you, Mr. Riddle.
Thank you, Mr. Chairman. Good morning. Thanks for being here. I want to change the direction a little bit to Social Security. Your report, I think, shows the Social Security Trust Fund actually going insolvent in 2031 now. Is that correct?
And becoming exhausted in 2031, yes.
2031. It seems in the 3 years that I've been here, that window keeps getting shorter and shorter. Some would say that we should wait till we get to 2031 and then address it, because Congress seems to react better to crises than to fiscal management. Is it more expensive to address it then, or is it more expensive to address it now? I mean, is there a cost to waiting?
There is certainly a cost to waiting, Congressman.
In what regard?
So the longer one waits to make changes, the larger the changes need to be, and the more abruptly they would need to take effect. For Social Security, right now, the age for full retirement benefits is working its way up, as part of an agreement that Congress and the President reached in the early 1980s. And that agreement was to do various things, including phasing in and increasing the retirement age over a long period. But the longer one waits to address the imbalance in Social Security and in the federal budget as a whole, the less time one would have to phase in any changes that you and your colleagues agreed to.
When you started kind of your first run or first stint over at CBO, I think it was back in the early 1990s, 93, 94, something like that. Were they talking about Social Security then? Because that was post those reforms. Were they also seeing this trend then?
Yes, it was very much on the radar of analysts, and in fact, later in the 1990s, there was a lot of discussion among policymakers. This aging of the U.S. population has been predicted for decades now. I recall Alice Rivlin, the first director of CBO, giving a talk that I saw in the 1990s, talking about how it wasn't really that far away. But nonetheless, a number of years have now passed with no changes.
So now we're 20 years past that date, and still no fix in sight. I'm assuming that the fixes, at least in the 3 years that I've been looking at this since I've came to Congress, the fixes seem to be relatively well known. CBO's spoken of them, and other members of Congress have spoken. Would you agree with that?
So we published a report a few years ago that had a long list of changes with estimates of their budgetary effects on people of different generations, different income levels. I think the menu of possibilities is well known, but people have not chosen off the menu collectively. Individuals have chosen off the menu.
At some point, we're going to need to do that. We're either going to be forced into doing it in a crisis, or we're going to do it thoughtfully and ahead of time and do it that way. Now, since to a certain degree, economists are professional speculators, I say that with a little bit of tongue-in-cheek. I would like you to speculate a little bit on how you might see the financial markets, the ratings agencies, and even the American people responding to a Congress that, with forethought and thoughtfulness, actually reform these programs to save and protect them. How would they respond?
I think that if our federal budget were to be put on a sustainable path, it could have a very positive effect on the confidence of businesses and households in a way that could provide a substantial economic boost. I don't know how to quantify that effect, but I think people now are very uncertain of what federal policy will be, very skeptical of whether those problems will be addressed in a timely way. And I think if they were, it would come as a very welcome surprise to a lot of people in a way that would be very good for the economy.
And if it's very good for the economy and good for the American people, that's probably good for politicians, I would guess. And I would really encourage this body, both of us, Republicans and Democrats alike, actually get serious about doing these things, because my sense is that political dysfunction is also a drag on the economy. Would you agree to that?
Yes, Congressman. We think that the uncertainty about where federal policies are going is one of the factors that has led to slow growth in the past few years. Not the principal factor, but a factor.
All right. Thank you very much for being here. I yield back.
Congressman.
Mr. Pocan.
Thank you, Mr. Chairman, and thank you, Dr. Elmendorf, for being here. It's a little bit ironic. I'm glad that we're having this conversation, but it's a little bit ironic we're having it at a time this body hasn't had a national budget. Our country hasn't for the last 4 years. We're going to talk about long-term, but we can't deal with the immediate. We've got the GOP-induced sequester that's having a drag on the economy, as you've pointed out, we're dealing with. Instead of being back in our districts this week, we're kind of held hostage back here on a Don Quixote mission to get rid of the Affordable Care Act one more time and to put us on the cusp of a government shutdown that, while we can't seem to do anything in the immediate, we're going to have a real good conversation about the long term. It just seems a little ironic that that's the position we're in. But if I could ask you a couple questions specifically about the long term and the Affordable Care Act, and then a couple about some of your, how you do some of the projections in the future. So specifically on the Affordable Care Act, taking the coverage provisions and other provisions of the Affordable Care Act together with the Medicare provision and other revenue provisions, what's your estimate of the effect of the entire Affordable Care Act on the deficit, and what would be the impact if we repealed the Affordable Care Act on the deficit?
We estimated that the Affordable Care Act reduced budget deficits and that repeal of the Affordable Care Act would increase budget deficits.
And what kind of levels are we talking about?
Over the next 10 years, on the order of $100 billion, and then beyond the next 10 years, a fraction of a percent of GDP.
Gotcha. And then two specific questions, specifically to how you determine some of the projections. You've said that healthcare costs are growing much more slowly in the last 5 years, and just since the last report, you've got that projection in there. I'm just wondering how many years, how much frequency do you need to see in reduction of the healthcare costs before you change the per capita income, the growth estimates? Just trying to get a picture of what it takes for you to change that course a little bit so we can look at different numbers maybe in the future.
So we have already changed course to a significant extent. Relative to our projections in 2010, actual spending for Medicare and Medicaid have now fallen about 5% below what we thought they would be. And we've lowered our projected growth rate over the rest of this decade so that by 2020, projected Medicare and Medicaid spending are 15% roughly below what we projected a few years ago. So we have, in fact, extrapolated some of the slow growth rates we've seen into slow growth rates going forward. And we think it's appropriate because the slowdown in health cost growth has been very broad across different sectors of the healthcare world and has now lasted for half a dozen years or more. But at the same time, past episodes of slow health cost growth have been followed by pickups in health cost growth. And the underlying driver of a lot of health cost growth is the development of new procedures and techniques and technologies, and that is continuing. So we don't think it's appropriate to take the last half dozen years and then just extrapolate those low growth rates out for decades to come. So what we have done is to bring down the long-term growth rate a little bit in response to the data we've received. But mostly you should think of this as lower growth for a number of years and then a return close to previous growth rates, but for a significantly lower level of federal health care spending than we projected a few years ago.
So would it be more significant if you saw a decade of reduced spending? Would that have a different impact? Or
Yes,
how would you...
I think the longer that this period lasts, and the more that we and others can learn about it. We did a very detailed analysis of the slowdown in Medicare cost growth, released a lengthy paper a month ago, and one of our conclusions from that analysis was that the weak economy does not seem to have been a factor in holding down Medicare growth, spending growth, and thus that an improvement in the economy won't necessarily undo the slower spending growth. So as we and others do this kind of research, that affects our estimates as well.
If I can just get one more question, and I've got about a minute left, is on the Social Security deficit, you know, I know that increased life expectancy. Can you break down the projected shortfall due to people who are 50 and over versus, you know, the children and grandchildren? Because I know I think a lot of people make certain assumptions, but there's going to have that continued projection in the future. Is there a breakdown that you...
We have not broken down the shortfall by generation per se, but we do have a figure in the report that shows the taxes and benefits for different people born in different decades. And for most people born in the, on average, across the 40s, 50s, 60s, 70s, and 80s, those peoples have payroll taxes over their lifetimes. They're pretty comparable to the benefits they're going to receive over their lifetimes. But the Social Security system started by paying benefits to a collection of people who had not paid into the system because the system wasn't there when they were working. And that has created essentially an ongoing debt in a way. And that's really what the future generations will have to deal with.
Thank you. Mr. Williams.
Thank you, Doctor, for being here today. Appreciate it. I'm a small business owner, 73-year family business, myself 42 years, and I've been a borrower all my life. And you know where I'm going with this. I can tell you Main Street America is not back. Some of our friends say the economy's come back, it's doing well. It's not doing well, as evidence of the high unemployment rate that we could still continue to have, underemployment and so forth. It's not, because people like me are concerned, where are we on taxes? You know, where are we on health care? We're all playing defense, afraid to hire anybody, afraid to put capital at risk because we don't know what kind of return we get. But all that being said, I'm of the age that I remember that I borrowed money in 1980 at 20%. And now I'm able to borrow it almost in many cases 0%. And of course we know which is better than the other. But I can tell you that there's a lot of industries that have seen costs go up 6 times or 7 times since 1980. And, you know, rates back then were, as I say, 20%. And in my lifetime, a 6% rate has been a pretty good rate. We've been able to do well with that. But the problem is with the cost being up so much, you know, 6% of, say, $60,000 is right now would be more than, say, 20% of $10,000. So there's a problem there developing, and I think it's a real concern. And the rates can kill small growth in business. It can kill, nobody's really thinking about it. And I know you've talked about rates are going to go up because of this mismanagement of in many cases, of our deficit, the huge deficit we continue to run up and not want to cut costs by some people. I think, and I hope you would agree, that the answer is lower rates. You know, lower rates generate cash to grow and spend. If you have a lower rate, you just have more cash. And businesses don't save money, they spend money and they invest. I believe tax cuts are revenue permanently. We hear the other side talks about revenue, but then they always talk about tax increases being revenue. Tax increases will eventually burden small business to where they don't exist anymore, or they just have to, again, as I said, play defense. So tax cuts, I think, we've tried 0%, we've tried stimulus, none of that works. The last thing are tax cuts. And tax cuts are real revenue, whereas tax increases, I think, are temporary revenue because it puts a burden on job creators. So do you think that the solution with higher interest rates would be lower tax rates for all taxpayers across the board, which I think would mean more jobs? We've seen that in the history of our country. Mean more jobs. It would reduce unemployment and would create less dependence on the federal government.
Well, Congressman, if marginal tax rates were lowered, but the other changes were made in the tax codes, the same amount of revenue was collected, then that would be good for the economy. But if tax rates are lowered and nothing else is done, so that total tax revenue falls as well, which we think it would if tax rates were reduced, then the reduction in tax rates by itself is good for the economy, but the extra borrowing would be bad for the economy. So our projections here, for example, incorporate both of those sorts of effects. So it really depends not just on the tax rates matter, but so does the overall amount that the government is borrowing over time.
Well, if we took people off if we reduced unemployment, we'll say from 7.5% or underemployment that may be 12 or 15, if we reduce that down to 5 or 4%, let small business owners like me in Main Street hire people, that's more revenue. That puts more people in the system. That's real money.
Yes, so absolutely. Stronger economic growth can make a great deal of difference in the gap between spending and revenues that we're projecting here. The question is what policies you could implement that would spur growth. And again, I think that under the current economic conditions, tax cuts or government spending increases could spur growth, but over time, then one wants to bring the budget more into balance, keep debt from rising so rapidly in order to keep economic growth going.
Well, we do have one of the highest tax rates in America, in the world right now, and it doesn't seem to be working.
So the corporate tax rate in this country is higher than it is in other countries. That's right, Congressman. As you know, the total amount of tax revenue that we collect as a share of GDP is smaller in this country than it is in most developed countries.
Well, I just think that we need to remind people, in my belief, that tax cuts are real revenue. Tax increases are temporary and put a burden on small business. Mr. Chairman, I yield back.
Mr. Schrader? No, he's not here. Mr. Cicilline.
Thank you, Mr. Chairman. Thank you, Dr. Elmendorf, for this excellent report and for being here today. You said in your testimony that our non-defense discretionary spending will be at levels not seen since the 1930s. Is that correct?
Yes, as a share of GDP, yes, Congressman.
And so that the focus of your report is that health care and Social Security and interest or debt service are the three principal drivers of our debt.
Yes, that's right.
And one would think that we should be putting together a plan to protect and strengthen those programs, be sure that they're being administered in a cost-effective, efficient way, and also a plan on how to pay for them. And that would be done in the context of the development of a budget, right?
Yes, it could be, Congressman.
And it would be helpful, of course, if we had a budget conference committee charged with doing that. And I hope, this report really underscores the urgency of adopting a budget and addressing these issues. And I hope you will mail a copy of this to the Speaker of the House with a note that appointing a conferees to a conference committee is the next step because we can't do a budget conference without him. But I want to specifically ask you about two issues that you focused on in the report. And the first is that, as you know, we passed a continuing resolution that would partially defund, and now there's some effort to pass a resolution to completely defund the Affordable Care Act. And it will also, the continuing resolution also doubles down on sequestration. And as I look through your report, what really struck me, and your testimony again today affirmed it, you continually cite the rising cost of health care as one of the single biggest drivers of our long-term debt. And you go on to say, though, that the rate of increase in health care has declined, and that you expect that isn't a flash in the pan. This is going to continue for some time, correct?
Yes, Congressman.
And so it's sort of hard to understand if the Affordable Care Act is contributing to deficit reduction, why the strategy is being advanced by my good friends on the other side of the aisle to repeal this deficit reduction tool called the Affordable Care Act in an effort to reduce the deficit. I mean, am I missing something?
I can't and won't speak to the motivations of you and your colleagues.
So, but there's no question the Affordable Care Act, if it were repealed, would substantially add to the deficit.
We estimate that repeal of the Affordable Care Act would increase the deficit over the next decade and in the longer term.
And that's because there is built into it a whole series of payment reforms and demonstration projects and competition that is going to create additional pressure to lower costs. Correct?
Because the spending cuts and tax increases in the legislation as it was enacted slightly outweighed the cost of the coverage expansions, and those factors would run in reverse if the law were repealed.
And so with respect to the sequestration, you've already testified in your report confirms that the maintenance of sequestration will result in substantial job losses both in the current year and in the next fiscal year.
Yes, compared with a policy that relaxed that restraint on spending.
And restored spending back to the pre-sequestration levels. And what is the impact of that on the deficit, both in the short term and the long term?
Well, so stronger economic growth would reduce the deficit, but I don't want to leave the impression that we think that relaxing the sequestration would pay for itself. Like cuts in tax rates, that can be good for the economy, but not so good that the extra revenue offsets the cost of the initial cost of the tax cut.
But your report reveals that in the long term, the replacement of sequestration with a balanced approach will lead to a stronger economy and a reduction ultimately of the deficit.
So if the extra costs of relaxing sequestration were offset entirely by other policies that at some point in the future would raise taxes or cut spending, and if those other policies were actually adhered to, then one could have stronger growth in the near term with no worse or better economic conditions in the long term.
And a reduction in the deficit.
And a reduction in the deficit.
So these two sort of policies that we have heard so much from our friends on the other side of the aisle, you know, maintaining sequestration or making it worse, or repealing the Affordable Care Act, both of those things taken together in terms of the long-term impact will actually increase the deficit.
Well, I want to be careful because I think it depends on the policy, on the combination of policies. So again, in the short term,
I'm asking about the long term.
A little more federal spending. So in the long term, if a combination of policies reduces spending or raises taxes, then that would put the budget and the economy on a stronger path. But you have to get to those policies, and if one doesn't do them this year or next year, then one has to implement them in the years after that.
Thank you.
Mr. Nunnally.
Thank you, Mr. Chairman. Thank you, Dr. Elmendorf, for being here.
Congressman.
I'm going to ask questions on a couple of graphs in your report, starting with page 2. While you're turning to the bottom graph, you've already talked about how the driver of our debt is Social Security, health care programs, and interest. And the bottom graph on page 2 seems to bear that out. My quick observation of math in that our current situation is that if we add the lines today for Social Security, for health care programs, and for net interest, the total of those three roughly about equals what we're spending on all other non-interest spending.
That's right, Congressman. It would be a little higher, Yes, it's close to that, Congressman.
And then when I follow the graphs out 2038, I see that the three things that are driving our debt continue to get worse, while other non-interest spending goes down. So again, my quick observation and math by 2038 is that Social Security, health care programs, and interest are about double what other non-interest.
Yes, Congressman, I think that's about right.
All right, and now turn over to page 10, the graph on page 10, just showing our historical debt as a percentage of GDP. I see 5 significant spikes. The Revolutionary War debt, Civil War debt, World War I, and World War II. And then the spike that I see going out to beyond 2030. And what keeps me awake at night is to see that our debt is growing not to pay the cost of defending freedom, but to pay for benefits for ourselves. And the thing that keeps me awake is seeing my grandson or my granddaughter sitting in this chair in 2038 and having a repeat of December the 7th, 1941. And we find ourselves so much in debt, we cannot afford to pay to defend ourselves. Is that a valid fear?
I think that's a valid fear, Congressman. We say in the report, and it's said a number of occasions, one of the risks that's posed by having debt that is so high is that you and your colleagues lose the ability to respond to unexpected developments, economic crises or wars, in the way that you would have the ability to respond if debt started at a lower point.
And this week we're debating debt ceiling. And as I see it, the debt ceiling that we place upon ourselves is an artificial debt ceiling, and I think it's a very valuable artificial debt ceiling that allows us to have this debate. But the real debt ceiling that any family, that any business, or any government faces is when we get to the point when we can no longer find people to lend us money at a rate we can afford to repay.
Yes, Congressman.
As I see that spike going to 2038, it puts us in that position very quickly, and it certainly puts us in a position in the event of an unplanned catastrophe, such as December the 7th, 41, comes upon us.
Yes, Congressman, that's right. We talk in the report about how this sort of run-up in debt that we're projecting doesn't have a precedent in U.S. history. We've had run-ups before, as you noted, but they've been for particular circumstances and then have then been reversed. And this would be unprecedented, and it reduces our ability to project just what would happen to interest rates under those conditions. And we note that, and we also highlight the risk that you are referring to, that if one has a high debt and then one hits a depression or one hits a war, then the country could really be in a very tight box with nothing but poor options. And that's why analysts think it is far, far better to take action sooner rather than later.
You know, we've labeled the generation of the 1940s as the greatest generation, and they did defend freedom and earn that title. But in my opinion, an equal characteristic of greatness is their commitment to repay the debt that was incurred to defend freedom. And it appears that my generation is incurring debt to fund our own excesses, and we're willing to pass that on to our grandchildren, and that's simply not acceptable. So thank you.
Thank you, Mr. Hoppin.
Thank you, Mr. Chair. There we go. Thank you, Mr. Chair, and thank you very much, Dr. Elmendorf. It's been an interesting discussion, and it's even been interesting that we've had a few practitioners of political ideology interrupting and disagreeing with and attempting to re-educate our independent PhD, nonpartisan economist who Congress turns to for answers in these situations. I think those who are watching have had an interesting window into some of the forces that have taken us to the brink of a government shutdown in that discussion. I am, of course, sobered by this mountain of debt that you are projecting, that we're grappling with. I think everyone in this institution should be, and I know that Democrats are very sobered by it. In fact, we may even be more dismayed because we have gone in a pretty short period of time from 2001, when following 8 years of the Clinton administration, your office was projecting we would be enjoying multi-trillion-dollar surpluses at this very point in time, to this mountain of debt that you're now projecting. And we could certainly probably have more discussion about how we got here, but it seems to me that putting a couple of wars on the national credit card, cutting taxes for the rich, and looking the other way while Wall Street crashes the economy had a lot to do with it. In any event, it also seems to me that we have 4 issues that are immediately facing this House that could have either a positive or a negative effect on this situation, depending on how we resolve them. The first of which is the sequester, and I want to just understand your testimony. I believe you said that continuing the sequester, which is what our Republican colleagues are suggesting in their CR and other proposals in 2014, would eliminate 600,000 jobs and reduce GDP by as much as 0.5%. Is that correct?
Those are our estimates for the end of 2014. Yes, Congressman.
Thank you. And then with respect to the debt limit, I think you were completely unequivocal in stating that a default of any kind could have catastrophic effects on our economy and our recovery.
I said that a default on any obligations the federal government could have effects that are large, lasting, and very damaging to our economy and our financial system and the federal budget.
All right, so that's the second big issue facing us right now in Congress. The third is the Affordable Care Act, what will inevitably be the 43rd proposal in the days ahead to try to repeal it. Just to be clear, the Affordable Care Act is a net budget saver, correct?
That's our estimate, Congressman, yes.
So repealing it would actually make things worse?
Yes, Congressman.
And finally, we should be talking about, we're not, but we should be talking about comprehensive immigration reform along the lines of the bipartisan proposal that the Senate has advanced. What would the net effect on these fiscal challenges be if we could pass a bipartisan comprehensive immigration reform bill like the one that came out of the Senate?
Congressman, we estimated that the proposal that was approved in the Senate would improve the budget balance, would increase output in the economy over this coming decade and beyond.
All right. Thank you very much for your testimony. Again, there is no dispute that we face a serious challenge here, but rather than exchanging rhetoric about it, we have 4 things that I've just highlighted that are pending before this House that we can do to make it better or to make it worse. And I think your testimony has been very illuminating in that regard. Thank you, Dr. Elmendorf, and I yield back.
Thank you, Congressman.
Thank you. Mr. Rice.
Thank you, Mr. Chairman. Thank you, Mr. Elmendorf, for being here today. Your study, and you said earlier that increased taxes are a drag on GDP. Is that correct?
Said that higher tax rates for any given level of revenue is a drag on GDP, but it matters, of course, what the total revenue collected is as well.
What percentage of our economy is consumer spending? Do you know?
I think as a share of GDP, consumer spending is about 2/3 or 3/4.
And taxes take away from that, correct?
Yes, Congressman.
All right. And what are taxes? How do you define taxes? They were talking about confiscation earlier, but it's a government exaction.
So in the federal budget, revenues are monies that are collected through the sovereign power of the government.
I want to look at it a little bit expanded view of taxes to not necessarily something collected by the government, but exactions forced by the government. So, for example, if we have our utilities bills go up because we have a war on coal or we refuse to use our own natural resources, does that affect consumer spending?
Yes, it does.
Negatively?
Yes, higher prices for energy are one of the big causes of swings in consumer spending in the past several decades.
And if we require people to buy insurance and their premiums go up, does that affect consumer spending?
Well, Congressman, it depends what else happens, and I'm not trying to be coy here.
If they have less money in their bank account at the end of the month.
Congressman, yes, but as I noted earlier, some of the increase in premiums under the Affordable Care Act that we project comes from a reduction in out-of-pocket payments. That also affects how much money people have at the end of the month.
I just
So you
read
need
in
to
a
look at the
in a
overall
Forbes
effects.
article, the average woman's premium will go up 60%, and the average man's will go up 90%. I don't know. That's just what this Forbes article said. And if interest rates go up, that's another factor, because we can't get control of our budget deficit. That's another factor that's going to take more money out of consumers' pockets and less money in their bank account and less consumer spending, right?
Yes, Congressman, I think that's
And
right.
the way I view these, really, they're all taxes disguised, because they're all the result of government action. Increased insurance premiums, increased utility bills, increased taxes with the fiscal cliff deal, and now with the imposition of the Obamacare taxes, and increased interest rates. They all lead to lower bank accounts at the end of the month and lower economic activity.
But Congressman, the problem that you and your colleagues face is that a cut in government benefits takes money out of consumers' budgets, and an increase in taxes takes money out of consumers' budgets. Yet, in the end, the amount of taxes that are collected and the benefits that are paid are going to have to come into closer alignment than would be the case under current law. So you don't really have a choice, ultimately, if our projections are at all right, in either raising taxes or cutting spending.
I'm curious about one thing. You said earlier that that our average tax collections projected 5 years out under current law are going to be higher than they have been in the past. Average.
Yes, that's right, Congressman.
Is there some, and I just want a quick answer to this, is there some kind of a sweet spot, where you get diminishing returns with tax rates, that, some kind of a Laffer curve analysis that you shouldn't go over, you'll have substantially decreased economic activity?
Well, as tax rates rise, they will have incrementally bigger negative effects on output.
But we're already over our average. Aren't we dancing around that?
Congressman, I think not. When economists try to estimate, again, each increase in tax rates will have some more negative effect on the economy, but still, total tax revenue will go up until tax rates are a good deal higher than they are right now.
I hate to cut you off, but I'm running out of time. But, we're taxing with taxes, we're taxing with increased insurance, we're taxing with increased utility bills, we're taxing with increased interest rates. It seems like we're going to wring people dry. Second thing, we talk about you've analyzed the effects of sequester on jobs. Have you analyzed the effect of Obamacare on jobs and how many jobs that's killing and costing and hurting?
So we did an analysis of this in 2010, Congressman, and our estimate at the time was that the Affordable Care Act would reduce the level of employment in the country by about 0.5% by the point at which the law was fully phased in, and that was equivalent to about 800,000 full-time equivalent jobs.
Okay, so which one's the biggest job killer, Obamacare or sequester?
So the effects of the Affordable Care Act on employment in 2018 or so, that was about 800,000 full-time equivalent jobs. The effects of the sequester for this coming year, we think, is about 600,000 jobs.
I want to tell you, I'm getting hundreds of calls in my office, and they're not about sequester, they're about Obamacare. Thank you.
Thank you, Mr. Cardenas.
Okay, there it is. Thank you. Yeah, I think one of the reasons why so many people are getting calls about Obamacare is because there's millions upon millions of dollars being spent on attacking Obamacare, and it hasn't even been fully implemented yet. So I think that Americans are just reacting to the airwaves and what they're hearing because they're getting scared into believing that Obamacare is something that they should be afraid of. Well, one of the things I'd like to point out is that, before I got involved in being an elected official, I was a former business owner, and I know what it's like to be a business taxpayer, but also a domestic employer as well. And one of the things that I'd like to point out for the record as well, Congressman Rokita made a statement about increasing taxes up to 100% of income, basically, is what he was describing. And there was no Democrat to second that as a motion. So I think that we showed a lot of restraint there. That was a joke. Anyway, at least somebody laughed. Thank you very much. So when it comes to immigration reform, my colleague, Congressman Huffman, just touched on that, but I'd like to expand on that. Immigration reform, will it benefit domestic American employers if a comprehensive immigration reform, for example, we have one on the table that the Senate passed, that version, would it benefit domestic employers?
So we didn't study the effect on employers per se, Congressman. We looked at the effects on employment and on output and so on.
But people get employed by employers eventually at the end of the day.
So we concluded that relative to the current law, enacting the Senate bill would increase the size of the labor force and employment, would increase average wages in 2025 and later than that, would boost the amount of capital investment, raise productivity.
Now, is that in just one corner of America, or would that be pretty much in many, 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 many parts of America?
It would be disproportionately in places that the additional immigrants would come to live and to work, but we didn't try to do an analysis at a regional or metropolitan
So, for example, it would have a net positive effect based on your numbers in California.
Again, we didn't do estimates for particular states, but it would tend to have the larger effects would be in places that attracted more immigrants.
Well, when you look at the tech industry being large in California and the ag industry being large in California, I think that your numbers probably, the conclusion of your numbers came from, by and large, communities like that. But to my next point, I think a lot of Americans think that a comprehensive immigration reform would only benefit foreign-born individuals should we pass something, for example, like the Senate bill that already passed the Senate but is not getting a hearing in this House. Would it benefit just foreign-born people in this country, or would it benefit American-born individuals economically and foreign-born individuals? So it would only exclusive to foreign-born individuals?
It's not exclusive to foreign-born individuals. It would benefit some people who would live in this country anyway. We have not done the full analysis divided among foreign-born individuals and native-born individuals. But the effects would spill over. Some of the effects are negative, as we noted. The unemployment rate would be slightly higher over the next, through 2020. But in the longer run and on average, we think it would be good for people. But the specific effects will differ depending on the people's situations.
So let me ask the question then a little bit more specifically. A comprehensive immigration reform law, like the one that the Senate passed, which I would assume has been analyzed by you and your people, that would only benefit foreign-born individuals in this country, or it would benefit both foreign-born and American-born?
It would benefit at least some American native-born individuals.
So the answer is both?
Both groups.
By and large, will benefit?
Both groups would benefit over time, Congressman.
Got it. And the reason why I asked that question is because I think that a lot of people in this country believe that the debate on immigration reform has no net economic effect to Americans, and that's just simply not true. Another thing that I'd like to point out is when it comes to American corporations that have much of their employment overseas, does that have tend to have a direct benefit to households with incomes of blue-collar workers in this country?
Congressman, that's a very hard question. It depends on what the companies do.
That's why I said direct, not indirect.
So in some cases, I know, but a full answer from an economist needs to take account of the indirect effects.
When an American corporation hires people domestically in this country, does that have a net positive effect on that household that got employment?
Yes, Congressman.
Okay, that's my point. Thank you very much. I yield back my time.
Mr. Woodall.
Thank you, Mr. Chairman. I appreciate my colleagues' discussion about immigration. I would say if we reframed that debate, instead of asking what's good for immigrants, asking what's good for America, we may end up with the same conclusion either way. I appreciate what Dr. Elmendorf had to say. I'm glad the House is doing it in a step-by-step approach. I applaud what the Judiciary Committee is doing, but the question should always be what's good for America, and the answer has always been that a robust immigration policy is good for America.
I agree.
It was mentioned in passing, Dr. Elmendorf, your July 2010 report on about 30 different options for rescuing Social Security from bankruptcy. If we went back and looked at that, I know you may not be prepared to talk about that today. Have economic conditions changed in the last 2 years such that that report would need to be updated, or are those numbers still as reliable today as they were 2 years ago?
If we did new estimates today, they would be somewhat different, but I think the broad conclusions, the comparison across estimates, across policy options in that report would still be valid for you.
What you showed there is not only what the size of that problem is, but how absolutely doable it would be by pulling on somewhere between 1 and 4 levers that we have to pull on to make those changes today that would take this off the table as a worry for generations to come. They took a big step in a bipartisan way in 1983 to do that. I feel like we have the opportunity in divided government today to do that, and I appreciate the foundational work that you all have done there. Folks ask me why we're talking about health care in the time of budget deficits and budget crisis, what that connection is. I think of federal health care costs as being one of the largest drivers of federal spending long term. Is that the
Yes, that's
CEO's
right.
conclusion?
Absolutely, Congressman, yes.
Well, when we talk about whether the Affordable Care Act is helping or hurting, you've said several times it's a net positive on budget deficits. But I'm looking here on page 25 of your report. You may not have it handy, but it's a chart that talks about projected growth in federal health care spending. And I'm looking out over the next 10 years, and you divide major growth into 3 different categories. You talk about the aging of the population. Obviously, as we get older, we have programs that cover the elderly. That's going to drive health care costs. You talk about excess cost growth. I think that's an economic term for when inflation is higher than ordinary inflation and what that does to divide.
Spending in health care per person outpaces the growth in spending GDP.
But then you talk about the Medicaid expansion and exchange subsidies. And if I'm reading this chart right, you're saying that over the next 10 years, health care is already one of the largest drivers of spending in this country, federal spending, and you're saying that the Medicaid expansion and exchange subsidies are going to be responsible for 53% of the increase over the next 10 years. Am I reading this right?
That's right, Congressman.
So the connection between budgets and the Affordable Care Act is not only have we identified federal health care spending as the single largest driver of debt and deficits as we look out over the horizon, but 53%, actually no, 53% of total costs. You're saying that the Affordable Care Act alone is going to double growth in federal health care programs over the next 10 years?
So, Congressman, this row of this table refers to the insurance coverage expansions of the Affordable Care Act. The Affordable Care Act also includes, as you know, cuts in spending in Medicare and some other programs and increases in tax revenue. So my statements about the overall effect of the Affordable Care Act take account of the coverage expansions and the Medicare spending cuts and the tax increases. This row just has the coverage expansions. The Medicare spending cuts actually play some role in the excess cost growth line, but not in a way that we can break out at this point.
But am I reading that right? That if 53% of your total projected cost over the next 10 years is associated with the Affordable Care Act, that means in the absence of the Affordable Care Act, federal health care costs would be half. The growth would be half.
In the absence of the insurance coverage provisions of the Affordable Care Act, but maintaining the Medicare spending reductions in that act, then federal health care spending would be a great deal, small.
So when you talk about the Affordable Care Act as reducing deficits, you're not saying that the laws in the Affordable Care Act, the health care changes are reducing deficits. You're saying because the Affordable Care Act cuts $600 billion out of Medicare, you're saying because the Affordable Care Act raises over $1 trillion in taxes, you're saying because of all of the non-insurance related things that the Affordable Care Act does, that's why it has an effect. And if we were to do all of those same things, irrespective of their merits, we would just bank all of that for deficit reduction rather than spending it on new programs. I know that's not an economist's question. That's more of a rhetorical question. But I very much appreciate what you've done here. And again, your work on Social Security is the foundation that really does offer an opportunity for success in a bipartisan way. I thank you.
Mr. Ryan. Thank you, Chairman Ryan. And I appreciate the opportunity here. The chairman has not had lunch yet, and he's getting a little cranky. So I'll try to make this as brief as I can. Prior to Obamacare, and thank you, sir, for all your great work. Prior to Obamacare, what were health care costs going up? What percent?
So healthcare costs have risen. Healthcare costs per person have risen faster than GDP per person for decades in this country. That growth rate has slowed over the past half dozen years or so across the federal programs and in the private sector as well. The role of the Affordable Care Act in the slowdown we've observed so far is not clear to us. As you know, the Affordable Care Act includes a number of provisions that will slow health cost growth over time, cuts in Medicare payments, other changes in Medicare, a tax on high-cost insurance. But whether those provisions have mattered a lot so far is hard for us to analyze.
I remember running for Congress in 2002, and the #1 issue for businesses and families, health care costs. I don't know what it's going to be. It keeps going up. This is a major problem. So, we had a problem to solve, and we ended up solving it alone. We didn't have much help from the other side, although we did adopt several of their positions, like the individual mandate. So my question really was to get everybody to recognize that this has been a big problem, and we are now seeing things starting to slow down, and a lot of people who had pre-existing conditions and could not get health care are now able to do that. If you had a young kid with cancer, they would not meet their lifetime cap and then get thrown out. They will now be able to get that care. So we've and look forward to improving this as we go. I don't think it's a perfect health care bill. I'd like to make a couple comments here in the last few minutes. We had one gentleman make a statement about all these huge debt issues, Civil War, World War II, and another point in history, but then forgot to mention the 2 wars that we put on the credit card that our friends on the other side primarily initiated. Prescription drug bill, not paid for. No negotiations in trying to drive down prices. So I just think it's important as we have this discussion to say, well, we had these points in history where the debt ran up, and then all of a sudden President Obama got in, and oh, there's this other debt that just came, not looking back into the past decade. And my friend Mr. Rokita, who is a friend, and I like him a lot, was talking about public investments. We can't, the problem we're having today is the whole narrative in Washington, D.C. is every single dollar the government spends is bad. It's bad, it's coming out of the pockets of the private sector, it's stealing, it's confiscating money from private citizens. That fails to recognize, over the course of our history as a country, the significant public investments that have been made that led to economic growth. And as I was listening to him make his argument, I'm thinking about local politics. I'm thinking of the city of Youngstown or city of Akron when they put public money into an industrial park. Public sewers, public roads, public sidewalks, invest in, create an industrial park. Private sector comes in, takes risks, make the investment. But for the investment by the public to say this is where we want to go, that private investment wouldn't have had a chance to grow, and then those businesses grow over time. Same with the interstate highway system. Same with NASA. Those huge investments we made in NASA that many people thought were foolish led to telecommunications revolutions and all kinds of other things. Defense spending. You know, the oil coming in and out of the United States ports, guarded by a public investment in the United States Navy. Hundreds and hundreds of billions of dollars. I mean, these are investments that we make. Investments in research and development, like my friend Mr. Yarmouth was talking about, that eventually will lead to growth. And look at what's going on in Silicon Valley because of the investments on the public side. So I know we got deficits. You know we got deficits. We both know we need to curb these in the long term, but we can't sacrifice investments. And right now, we were lucky enough to get President Obama's first additive manufacturing initiative. We've got to continue to invest in that. Public-private partnerships. We've got to make sure our schools have three-dimensional printers in them so that these kids, and Legos and robotics, so kids get jazzed up about engineering over the long. Public investments, not the be-all, end-all, but this blend, this mix, recognizing the complexities of our economy.
Thank you. Ms. Blackburn.
Thank you, sir. I know you want to say save the best for last. We women are accustomed to that around here. Absolutely.
I just want to say I finally have found an agreement with the gentlelady from Tennessee.
We were at the same briefing that we stepped out of this committee for, and I told her it was a long queue. I want to go back, Mr. Elmendorf. First, thank you. Thank you for the report. And I enjoyed glancing through this and looking at the impact that you have on health care expenditures. And I didn't, in looking at your footnotes, I don't see where you pulled data from any domestic programs that may have yielded a window and some insight into what we're up against. You've got TennCare in my state of Tennessee, you've got Guaranteed Issue in New Jersey, you've got Romney Care in Massachusetts. And did you look at TennCare and the escalation of the cost of that program, the administrative and the beneficiary cost of that program, because it's the closest thing we've got to what Obamacare is. And just for the committee, TennCare was the test case for Hillary Clinton health care back in the mid-90s in Tennessee. And eventually it became 35.3% of the state's budget. It quadrupled in cost after 5 years of implementation. And our governor, a Democrat governor, excellent governor, did a good job. He had to come in and remove 300,000 people from the program and reshape the 1115 waiver program from CMS in order to address this. So did you all pull any evaluated data from that?
So, Congresswoman, I'm not personally very knowledgeable about the experience in Tennessee, but when we've done our estimates over the past several years of the Affordable Care Act, we have drawn on the experience that states have had and that private insurers have had. We've drawn on a very large research literature
so you did look at that.
in forming our estimates. Yes, Congresswoman.
Okay, so then that does lead me to believe, as to Mr. Woodall's point, that you're looking at the additional taxes and components, the revenue side, to try to make that an affordable program that on its own it would end up doing what TennCare and other programs did, which is kind of collapse under its own weight. Let me ask you another question. You know, I have two grandsons, a 5-year-old and a 4-year-old, and it is just really painful to me to look at what is happening with our nation's debt. And the closer we get to that 100% of GDP, and I had looked at France's public debt, they're at 95.1% of their GDP. And they're looking at a tax pause. Have you all taken a look at what is happening with some of these countries and looked at the steps that Congress would have to take if at that point to return our nation to a path of prosperity, how we back away from this debt? Are you looking and making the expectation that the only way we could do that would be higher taxes or increasing existing taxes?
So I think, Congresswoman, that you and your colleagues have the choice of raising taxes substantially, cutting federal spending substantially, or some combination of those two paths.
Well, it's no secret we're cutting the spending.
I understand, Congresswoman, but that's for you to say, not for me. And we are currently producing a large volume of budget options, the sort we do every couple of years, and that volume will include options for both cutting spending and raising taxes.
Let's say we do what France does, and they're looking at a 1% corporate tax. What kind of effect would that have on the economy?
Congresswoman, I can't do estimates of that sort in my head. And as you know, other countries are starting with very different economic systems, very different levels of taxes and spending. So we would try to learn from other countries' experiences, but they're hard to apply directly to this country because this country is different in a variety of ways.
Okay, let's talk a minute about sequester. I like the 2% across the board cut, do not like the cuts on the military. I think they're harmful. However, according to your report, if Congress reverses the sequester cuts, our nation's debt would reach nearly 190% of GDP by 2038. So what do you think tell me what you think. Is it safe to say that the sequester cuts are preventing our long-term debt from doubling when you consider if we keep current law and we do not make any changes that our public debt would reach 100% of GDP?
So, Congresswoman, the alternative fiscal scenario that you're referring to incorporates a set of changes relative to current law, one of which is taking away the sequestration and going back to the original caps on discretionary funding from the Budget Control Act. But there are also big differences in tax policy and in other aspects of spending policy in that alternative scenario. So I don't know how big the effect would be of the sequester turning off the sequestration by itself. But certainly it is true that if spending were increased or taxes were cut relative to the current law that underlies these projections, and no other changes were made that offset those changes, then the debt would be higher and the problems would be bigger and would arrive faster.
Thank you. Ms. Lujan Grisham.
Thank you, Mr. Chairman, and thank you, Director, for being here. And I'm actually going to do a couple things. So I know most of the questions, quite frankly, have been asked, and most of us have been very clear about this report and all the information that we get about the fiscal condition of the United States and the federal budget. The deficit and the debt are stark and striking and require us to do something because they're incredibly serious. And I think there was a member on this committee who wasn't clear about that from your report and who wasn't clear about that before this report and isn't looking forward to the kind of budget options that we need to undertake. But I would like to go to two balancing issues, and I'm actually, with all due respect to my colleague, Mrs. Blackburn, she's very correct about how she talks about TennCare and its model as states looked at ways to do something different about their Medicaid programs and their populations. The trick for states in that regard is that they did it alone. All right, so they had no way to impact Medicare. They had no way to impact CMS rules on hospitals and hospital reimbursement. And the problem then is that it can be unsustainable. And so quickly, and there was no partnership on the Medicaid side from the federal government to be as robust as it is today to really deal with a growing uninsured population. And so they don't work. Or they haven't worked very successfully. So let's start with that. And actually, Tennessee's, some of their hospital corporations are in New Mexico and are big supporters of the ACA and Medicaid expansion because those rural hospitals will go belly up in the current path that we're on in healthcare. So I just want to reassess and make sure that I'm getting this right. That the Affordable Care Act expanded coverage, just raised some revenue, and reduced spending for Medicare.
Yes, Congresswoman.
And I want to know what that impact of continuing that kind of a balanced approach where you're reducing and raising has on the federal deficit over the next 25 years.
So all those provisions taken together in the Affordable Care Act, in our estimate, reduced deficits over the next 10 years and beyond in the second decade relative to what would have happened under prior law.
Perfect. So given that scenario, and in my state, that's been hugely helpful, and we're expanding Medicaid. We have a Republican governor who's doing that. We have the SHOP exchange. We're doing our own state exchange. We have some federal partnerships, recognizing that that's the kind of balanced approach that we want to a fledgling state budget, an economy, arguably, that's one of the worst economies in the country with negative job growth. We understand that there's going to have to be some balanced approaches to resolving this problem, both in the short term and the long terms, that we are affecting the debt and growing the economy so that we can manage those things effectively. And here, as we are, as many have said, colliding into the debt ceiling and recognizing that we've got a short-term issue that we've got to address, what's the impact on our economy if we weren't to address that and make sure that the full faith and credit of the United States, and I know that you've addressed this several times today, but since it is the issue of the hour, what happens to our economy again if we fail?
So we think that defaulting on any obligation of the U.S. government would be a dangerous gamble. Economists can't predict exactly what would happen because, fortunately, we don't have a lot of experience with that in this country. But the confidence in the federal government paying its bills on a timely basis is a bedrock of our economy and our financial system, meaning both the economy and financial system in this country and the economy and financial system around the world. And if that confidence were broken, then the consequences could be very harmful. And for the financial system, for the flow of credit, for the payments mechanism, for the economy, and ultimately for the federal budget. If interest rates on federal debt were to be pushed up higher than we think they would rise anyway because of a loss of confidence, that would raise interest payments. And the debt is so large now, and in our projections remains large for indefinitely, then the increase in interest rates, given the size of that debt, can be very costly. So if interest rates were about a percentage point higher than we project over the next decade, that would raise interest payments by the federal government by about $1 trillion over the decade.
And that's also going to have, I would assume, the same kind of effect on small business. And also listening to the sequester comments, I share those, that while we have an obligation and have been cutting the federal budget and being very clear about our obligation to do that. This sequester then leads to, particularly in the military, an inability to do that innovation and research and have that translate to economic growth in the economy. That predictability, that stability has certainly continues to crush New Mexico, and particularly my district in Albuquerque. And I would assume that that's the same issue without a balanced approach.
So, Congresswoman, as I mentioned a little earlier, nearly half of federal non-defense discretionary spending represents investments in physical things like highways, in the education and training of people, and in research and development. And if the path of overall discretionary spending and of the defense and non-defense pieces remains as is in current law, then that will and if the composition of that spending remains about the same as it's been historically, then federal investments will decline as a share of GDP in a significant way over the coming decade.
Thank you, and thank you, Mr. Chairman, for your latitude. I yield back.
Thank you very much. Dr. Elmendorf, thank you very much for your testimony. Thank you for this report, for the premium support report, and we'll see you this weekend.
Thank you, Mr. Chairman.
Hearing adjourned.
As this hearing comes to a close, the Congressional Budget Office Economic Outlook Report that was the focus of this hearing is available on our website, cspan.org. And with a possible government shutdown